വീട്ടിലാണ് മേഡം മക്കളൊക്കെയാണ് പരിപാടികളുണ്ട്. ആ അമ്മേ എന്റെ മകൻ എനിക്ക് നല്ലെണ്ണം വെട്ടി തരാമോ? പൈസ തരാം.
ആ ഏത്
പൈസ തരാം.
അമ്മ ഞാനിവിടെ 8-ാം തീയതി ഞാനിവിടെ ഉണ്ടായിരുന്നു.
ഇങ്ങോട്ട് അയച്ചു ചെയ്തത് camera used by another application.
Am I audible?
Yes, sir.
Tonight,
Yes, sir. Yes,
Sir,
sir.
sir, sir.
So should we start, sir? Hello.
Yes. The journey only.
Okay, we'll start, sir.
Yes, please.
Yes. Okay.
Yes, sir.
So thank you. Good afternoon, everyone. Namaskar. Welcome to today's web conference. As you know that Ministry of Ayush has assigned the sub-theme of integrating cancer care Ayurveda's role to Central Council for Research in Ayurvedic Sciences as a nodal unit for the 10th Ayurveda Day 2025 is scheduled on 23rd September 2025, and CCRS has nominated Central Ayurveda Research Institute, this institute, for conducting and coordinating the activities pertaining to the sub-theme of Ayurveda Day assigned to CCRS. In this connection, we have conducted 5 webinars, a series of 5 webinars which started from 11th of September till 17th of September. And today we are in the web conference on a theme Integrative Cancer Care, Institutional and Clinical Experiences, Scopes and Challenges. So with this, we'll start the program with the welcome address by Dr. R. Govind Reddy, Assistant Director in charge, Cari Mumbai. Over to you, sir.
Thank you, Dr. Manohar.
Thank
So,
you.
Om Dhunvantaraya Namaha. Very good afternoon to all, and welcome to Honorable DG Sir, Professor Vaidya Ravinarayan Acharya ji. A warm welcome to all the participants, teachers, and Honorable DDG Sir. And I am very grateful and thankful to the Honorable DG Sir for giving the opportunity to conduct this web conferences on integrative cancer care on the occasion of 10th Ayurveda Day program. And we have conducted 5 web series on the different topics and different uh, guest speakers. We got the very good response, sir. So we have conducted a first conference web series is on more than 1300 participants participated, and the second is more than 11, third is more than 11, and fourth is also more than 11, and fifth is more than 1000. And today is also there for this conference. Total more than 800 participants registered for this conference. And today we have the very good speakers like Dr. Vinita Deshmukh, Dr. Avinash Kadam, Dr. Vittal Huddar, Dr. K. Madhu. And for the panel discussion is also there. And concluding remarks by our Honorable DDG Sir, Dr. N. Srikant Sir. And we are working in this cancer care since almost all 13 years. So we have that means in my institution we have the special OPD and special admitted patients for the IPDs, and in the OPD special cancer care OPD and even breast cancers, thoracical, and many other this thing is available. And we have the collaboration with the TMC, Tata Memorial Center, and even Attract with the joint clinics started at TMC. And recently, Honorable Secretary Sir Ayush inaugurated the Ayush clinic at Attract. And we are doing a lot of clinical trials since many years. And we have screened the even medicinal plants, and one monograph is also published for the anti-potential cancer activity. And we are doing a clinical trials like even ovarian cancers and prakriti and ovarian, and even some mechanistic studies we are doing. So under the that means uh, our my technical in charge, Dr. Manoharji, and even in vitro in vivo studies is also going. And very proud to say that recently we have received the Center of Excellence for the Cancer at track with Cari Mumbai in the with the efforts of the Dr. Manohar Gundeti and Dr. Vikram Gota and Pankaj Chaturvedi sir, and even Gupta sir. So I welcome again to my honorable DG sir for this opening remarks. And thank you, sir. Thank you for your valuable time. You are on the way, but you are given the time to us for the your opening remarks. Thank you. Thank you very much, sir.
Thank you, sir. I request now Professor Vaidya Ravinarayan Acharya, the Director General, CCRS New Delhi, to give the opening remarks. Over to you, sir.
Thank you, Dr. Manohar ji. Uh, thank you, Dr. Govind Reddy ji, for giving a detailed but brief informations about the activities being carried out by our Cari Mumbai unit with special reference to cancer. And I congrats Dr. Manohar and team under the leadership of Dr. Reddy for organizing this dedicated 5 webinar on awareness programs of cancer wave of uh, 10th Ayurveda Day. Dear friends, no doubt today we have learned speakers like Dr. Sankna Puch, Dr. Pankaj, Dr. Sarath, and we are also Professor Dr. Benita Deshmukhji and Avinash Kadam, those who are working in the field of cancer, and Dr. Huddur and Dr. Madhu. We are organizing this webinars as an awareness program among the public, among the cancer patients, to public in general and cancer patient in particular about what Ayurveda stage and where Ayurveda manages, how Ayurveda manages these cancer patients. In a cancer patient, we are not claiming that Ayurveda will cure the cancer, the different cancer therapies, but as in today, we are not far behind. Ayurveda therapy is not far behind for the managing the cancer. Cancer management, the patients who suffer the cancer, we are suffering from the cancer, they are not alone suffering, but with them, the family suffers, the society suffers in terms of social, in terms of mental stress, physical stress also that, and also social stress also there in that. So to this manage this, Ayurveda has a lot of scope in terms of prevention, in terms of palliative care, and also to some aspects. There are a number of cases where our traditional healers are claiming that they have cured certain conditions of the cancer, or it may be of any origin, any place, or any type of cancer. There are certain claims. But being a scientific organization, we are of quite strong view that all the whatever we do claim, it must be with strong scientific evidence. That's why our cancer in our center, Central Ayurveda Research Institute at Mumbai, is a dedicated center under the Central Council of Research in Ayurveda for cancer therapy, cancer management. And as told by Dr. Reddy, since last 13 to 14 years, we are focusing on that, and we are sure that in future we will definitely come up with certain drugs or certain procedures which we can give benefit to the cancer patient. We have developed certain products, and we are closely associated with, as told Dr. Reddy, as a closely associated with Tata Cancer Memorial Cancer Research Institute in terms of mechanistic study, in terms of disease management study, and also palliative care. And I have some a few experience as a physician, as a researcher on cancer. We have also worked upon with Dr. Gundetti and at Mumbai Institute with Tata, help of the Tata, on the management of post chemotherapy with Bhanga. With cannabis, one of the promising drug nowadays, we have started for the first time a clinical study in India with pain management of, and we got success. So we published that article in one of the PubMed Index journal, and that says that we can publish good number of research articles where through different and claim that yes, Ayurveda is not far behind for managing certain conditions of cancer. With this, I wish the webinar series, we have already completed 4. This is the 5th, and as told by Dr. Reddy, a good number of participants, near more than 1,000 in each webinar, are attending and registering themselves, and also attending the lecture series. Public, there is interest. I also get social media feedback in the Facebook itself that yes, that's a good initiative. So I congrats Dr. Manohar and Dr. Reddy all for this purpose. And not only the not only our Mumbai center, we also other our Central Ayurveda Research Institute or Regional Ayurveda Research Institute. Just like today, we have a webinar from Jaipur Institute. We had a webinar of our other institutes yesterday. Also, we continuously, Kolkata Institute yesterday, we are having And today also our Cherututh unit, we conduct some webinar that Madhu was there. So we, in this way, we are in the service of the people of our country, and hope for with the support of all. May I thank Minister of Ayush also for giving CCRS the exclusive opportunity to conduct webinar on the eve of Ayurveda Day for cancer. Thank you. Thank you all. And I hope, I am not hope, but I am sure all the participants will definitely uh, enrich their knowledge in terms of management, in terms of research, and in terms of dietetic. Everything, our resource persons are quite enriched, and we hope all will enrich their knowledge. Thank you. Thank you all.
Thank you, sir. This insightful and also inspirational opening remark. Thank you very much for your support also to conduct this series of webinars and today's web conference. So, to inform the audience, the tentative program henceforth is we will have four speakers. They will deliver the talks. Each lecture will be of 15 minutes, and that will be followed by a panel discussion around 30 minutes, and three other experts will be there. To start with the first presentation is by Dr. Vinita Deshmukh to share their experience in the clinical experience in the field of integrative oncology. Uh, Dr. Vinita, Dr. Vinita Deshmukh, she's a professor and HOD in Sanskrit Samhita department at BSDT Ayurveda Mahavidyalaya, Wagholi, Pune. She is also Deputy Director at BSDT's Integrated Cancer Treatment and Research Center, that is ICTRC, Wagholi, Pune. Uh, she has a vast experience in research, in clinical, and also in academic experience. She is a guide for PG, PhD, and conducted various researches at Wagholi in collaboration with various institutes, including Tata Memorial Center. And he has published many papers in international reputed journals, along with delivering lectures at various forums. I have a big biodata, but I'm just briefing. On her credit, she has 9 patents. 9 Indian and US patents of Ayurvedic formulations are filed and published for adjunct treatment of cancer. She has received a Jivak Award and with the M.V. Kolhatkar Research Award. So with this brief bio, I will request Dr. Vinita Deshmukh to share her presentation and start. Madam, can you share the screen?
Yes, yes. Thank
Yeah.
you, sir. I'll share. Just a minute.
So with this short bio, I will request Dr. Vinita Deshmukh, madam, to start her presentation. Over to you, madam.
Yes, thank you, sir.
Before that, I will request all the participants to please be muted. So this will be essential for other participants to listen the lectures carefully. So thank you.
So, Dr. Manohar sir and Dr. Reddy sir, thank you for inviting me for this webinar. So today I will give just brief information about the work which we are doing in our institute related to cancer in Ayurveda. So our institute, Integrated Cancer Treatment and Research Center, is a center of excellence of Ministry of Ayush, supported by Department of Atomic Energy, Tata Trust, and it is empaneled under Mahatma Jyotiba Phule Jan Arogya Yojana, Pradhan Mantri Jan Arogya Yojana, and our hospital is accredited as NABH hospital. So the project was started in 1994 by Param Pujya Prabhakar Keshav Sardeshmukh Maharaj. His son, Dr. S.P. Sardeshmukh sir, and Dr. Arvind Kulkarni sir, who is a radiation oncologist and working as HOD in Bombay Hospital. And our research advisors were Dr. Sudha Gangal, Dr. Vidya Gupta, and Dr. Shubha Chiplunkar madam. We have a team of oncologists, Ayurvedic physicians, and basic scientists. The center is inaugurated by the then President of India, Pratibha Tai Patil, and supported by Padma Vibhushan Ratan Tata sir. So this is our campus, which has Ayurvedic as well as allopathic setup. We have a facility of conventional cancer treatment like chemotherapy, radiation, oncosurgery, ICU, diagnostic facilities, and Ayurvedic treatment facilities like in our campus, we have a manufacturing unit that is Atharva Nature Healthcare Private Limited, a state-of-art Panchakarma hospital, our own Goshala plantation department, yoga center, Ayurvedic diet department. We have a Ayurvedic drug testing laboratory, which is ISO certified, and biological science laboratory, which is also ISO certified. We all aware of the fact that the global statistics of cancer is, according to Globocan, is that there are estimated cancer cases worldwide till 2027 will be more than 50 million. So in 1994, when we started working for cancer in Ayurveda, initially our centers were only in Mumbai and Pune. But now we have our centers in various parts of Maharashtra and in India, like Aurangabad, Ahmednagar, Solapur, Kolhapur, Bangalore, Nasik, and New Delhi. We are treating patients from all over the world, patients from various countries like USA, Australia, Japan, Germany, are coming to take treatment for cancer at our center. And we have a global presence at various institutes globally. We are presenting our work and doing MOUs with them. So this is a brief demographic data. So till date, we treated more than 15,000 cancer patients at our center. Among them, 7,242 are male and 8,021 are female. These patients are basically divided focusing on Ayurvedic treatment aspect. So they are divided in four groups. So when patient is coming to our center, either that patient may be in group A, B, C, or D. A is a group of patients who are not treated with any conventional treatment, maybe due to some financial problem or age-related problem. So in such case, patients, the aim of Ayurvedic treatment is to control growth of cancer. Second group is a group of patients who are treated initially with conventional treatment, but right now there is a recurrence of cancer and now they are opted for Ayurvedic treatment to control cancer growth and immunomodulation. C group is a group of patients which is taking conventional treatment along with Ayurvedic treatment, and the aim of Ayurvedic treatment is to minimize the side effects of chemotherapy and radiotherapy. And D group is a group of patients who are initially treated with conventional treatment. Now they are disease free, but taking Ayurvedic treatment to control recurrence or metastasis. So the main aim of Ayurvedic treatment in this group is treating these patients with Shamana Chikitsa, Panchakarma, Rasayana Chikitsa to build their immunity and improve their quality of life and increase disease free survival. Now, first we will see that there are certain areas in which Ayurveda evidently contributes in primary and secondary cancer prevention and management. Because when we Ayurvedic physicians are treating cancer patients, we should aware what are the limitations of our pathy and what are the good things or what we can offer to cancer patients through Ayurveda. So these are the points which we should know before starting treatment of cancer patients. First thing is that establishing risk factors of various types of cancer from Ayurvedic perspective so as to ascertain them as carcinogens and co-carcinogens. We all know that nowadays there are many dietary products or many environmental factors which are ascertained as carcinogens. But from Ayurvedic perspective, there are various risk factors for cancer. For example, frequent use of curd, chili, or day sleep. These are the factors which are not considered in modern medical science, but these are the factors which may be the risk factors of cancer. So we should be aware of the fact and we should aware our patients to get rid of these factors. Second thing is establishing methods to diagnose cancer from Ayurvedic perspective. We all know that for confirming cancer patient, we have to rely on biopsy. But still, we can find out some methods to diagnose cancer from Ayurvedic perspective. Then there are the holistic Ayurvedic treatment modalities like oral Ayurvedic medicines like Shamana and Rasayana Chikitsa, Panchakarma and Shashti Upakrama. They are mainly effective in improving quality of life of cancer patients. Nowadays, we are aware of the fact that radiation and chemotherapy and surgery are the gold standards for cancer. But to some extent, these treatment hamper quality of life of cancer patients. So aim of Ayurvedic treatment is to improve the quality of life of cancer patients, which mainly depends upon Agni, Bala, Vyadik Shamatva, and Sattva. Second thing, increasing cancer-free survival, overall survival, and progression-free survival. Then regression of cancer. Management of cancerous ulcers and wounds. This can be achieved with the help of various Shashti Upakrama, improving immune status with the help of Rasayana Chikitsa, reducing oxidative stress with the help of medicines which are Pitta Shamak, minimizing adverse effects of chemotherapy and radiotherapy and post-operative complications, palliations of symptom, improving mental status of patients. Because we in Ayurveda we know we have a special type of treatment called as Satvavajay Chikitsa. And in case of cancer or a disease, dreadful disease like cancer, the such Tatvavajay Chikitsa is of very important. And very important thing that in community there are many people who are predisposed to cancer. So Ayurveda offers a special type of diet regime, dinacharya, rutucharya, lifestyle modification to these predisposed population to prevent cancer or to delay the occurrence of cancer. So broadly, these are the areas where Ayurveda can contribute in cancer. Now, in our center, we have some evident features of ICTRC for clinical and research wing. When patient arrives at our center, we are preparing a detailed CRF. The CRF comprises documentation about all aspects of Ayurveda, like identifying risk factors in the form of diet, lifestyle, addiction, occupation, emotional status, etc. Signs and symptoms of that patient, Purva Rupa, complications, clinical examination with the help of Ayurvedic parameters like Ashtavida Pariksha, Strotas Pariksha, Indriya Parikshan. Then the counseling of each and every patient and relative is done by Ayurvedic doctor and medical social worker. After this, a tailor-made treatment is opted to each and every each and every patient considering Ayurvedic principle. At our center, it's not a confirmed protocol for any type of cancer. We treat each and every patient as a separate patient, and accordingly, we treat the patient using Ayurvedic principles. Then, tailor made diet plan, lifestyle modifications are suggested for first visit, and close and long term follow up of patient is kept and documented. This is very important thing because in case of cancer, we all are aware of the fact that though the cancer is regressed with conventional treatment, a patient has a lifetime chance to develop recurrence or metastasis. So, close and long term follow up for each and every patient is very essential in the management of cancer. Simultaneously, the patient is checked by allopathic doctor and documentation of allopathic treatment, allopathic some parameters like radiological parameters or biochemical parameters is done for each and every patient. Our team of Ayurvedic doctors and oncologists work together for betterment of patients. This is the clinical aspect. From research aspect, various research projects on various types of cancer are designed under the supervision of our research advisors and expert clinicians. Data management and publication is done by expert team, and our project is multicentric, having its center at various districts of Maharashtra, state of India, and in various oncology hospitals, and even in Maharashtra University of Health Science, Nashik. Now there is a need why the integration is needed because we all know that allopathic treatment is a gold standard, but as we have seen, along with that, we want to improve the quality of life and increase cancer-free survival, which can be achieved with Ayurvedic treatment. So, what are the principles of Ayurvedic treatment? Very important thing is Shamana Chikitsa, which brings doshas and dhatus to his normal state. Because in all diseases, panchakarma is recommended as first treatment. But in case of cancer, patient is initially not eligible for panchakarma. So initially we have to improve strength of patient with the help of Shamana Chikitsa and Rasayana Chikitsa. And once the conventional treatment is completed, patient has good strength. Then frequently we have to treat the patient with panchakarma treatment. Along with that, Pachyakara Ahara, it is healthy diet, healthy lifestyle should be adopted, and counseling of the patient should be done. These are some examples. I will not go in detail because it will be a big lecture, but these are various pharmaceutical forms which we are using in cancer management. So, in case of single herbs, Amalki Churna can be used in stomach cancer, colon cancer, leukemia, and side effect of chemotherapy like nausea, vomiting. Herbal mixtures like Triphala Churna or Hingvastak Churna can be used in various conditions. Tablets like Anantavati, Gokshurvati, Shatavati, single herb tablets are used in case of various types of cancer. Kalpa like Shatavari Kalpa, Badam Pak, they are also used in various cancers. Then medicated ghees we are using a lot, especially to mitigate the side effects of chemotherapy and radiotherapy. For example, Yashti Madhubruta in oral cavity cancer. Asavarishta play an important role in cancer for Jataragni Deepan and Dhatavagni Deepan. So Kumari Asav, Pippalya Asav are commonly used at our center. Various Gugul Kalpa like Triphala Gugul, Gokshuradi Gugul, Punarnava Gugul are used according to types of cancer because we know Gugul has a capacity named as Arbudahara, Shothahara and Arbudahara. Medicated oils are used to treat various ulcers for local application. Also, medicated oils are used in various Panchakarma treatment. Sugar based granules we have already seen, and very important preparations of Suvarna Bhasma. We know Rasayana Chikitsa is very important in the management of cancer, and among Rasayana, Suvarna Bhasma is a very important Rasayana which we can use in various forms like Suvarna Suchekar, Raupya Suvarna Suchekar, Suvarna Malini Vasanta, Suvarna Basmadi Yog. There are various forms of various formulations of Suvarna which we can use in management of cancer to build the immunity and to improve quality of life of cancer patients. We have in our campus we have Atharva Nature Healthcare Private Limited, which is a FDA approved and GMP certified Ayurvedic pharmaceutical which manufactures Ayurvedic medicines for our cancer patients. We have a huge campus where we have various species which we are using in Ayurvedic medicines. So we have a project called as BSDT Flora in which we have a natural habitat and cultivated plant species. We have a compilation of these species. We have a 60-bedded state-of-art Panchakarma hospital which is funded by Tata Trust because what we have seen that cancer patients, if they are treated with Panchakarma treatment yearly, the chances of recurrence are very less. This is a demographic data. Till date, we have treated more than 1,500 cancer patients with Panchakarma. Most of them are treated with Basti Chikitsa because Basti Chikitsa is a treatment of vitiated Vata dosha, Vikrut Vata dosha. So initially we treat patients with various types of Basti like Krumigna Basti, Yapan Basti, Eranda Muladi Basti, Tiktakshir Basti. And after Basti Chikitsa, we treat them with respective type of Panchakarma. For example, in breast cancer, Vamana Chikitsa. In case of liver cancer, some Rudu Virechana are given. In case of liver cancer, we treat some patients with Rakta Mokshan. In head and neck cancer, with Nasya. So, Panchakarma plays very important role along with Shamana and Rasayana Chikitsa in management of cancer. We have many patients, we are yearly coming to our hospital and taking Panchakarma treatment on admission. They are admitted for 14 days or 21 days taking Panchakarma treatment, and we have carried out some projects with Dr. Shubha Chiplunkar that what is the role of Panchakarma treatment in cancer, and what we have observed that the Panchakarma treatment definitely has a immunomodulatory action. Now, diet is also an integral part of cancer treatment because a patient should be advised a typical type of diet during chemotherapy radiation to improve appetite and digestion and to improve immunity. So, nutritious status of patient should be managed in case of cancer. So, this is our kitchen, which we are giving various types of Indian food to our cancer patients. Mental health is also very important with the help of counseling, yoga, music, family members counseling, support group, and treatments like Shirodhara. So these are our sessions for counseling and meditation. Now, on the basis of this experience, in 2015, we have carried out 4 clinical trials, and these trials were funded by Tata Trust and CTRI registered. So I'll go through each and every trial, and I will show you the results of these trials. And we have used 14 Ayurvedic formulations with 84 herbal, mineral, and metallic ingredients in these trials, and these medicines were tested in drug standardization laboratory and in IDRAL, then CSIR NCL, and the toxicity study was done at Dr. Gotas's lab at ACTRAC. So the basis of this trial was our first publication in 2014, when in supportive care of cancer we have published one paper regarding effectiveness of Ayurvedic treatment in alleviating drug toxicity and improving quality of life of cancer patients treated with chemotherapy. But in this paper, we included patients of all types of cancer, and with the help of reviewers' comment, we designed next project about especially breast cancer patients undergoing chemotherapy. Here we developed one chemo recovery kit with coral, that is Praval. It contains Kamadudha, it contains Praval Pishti, Padmakadi Ghruta. So this kit was used in many cancer patients, and we published a paper on this kit where we have observed that this kit is effective in management of side effects of chemotherapy, mainly nausea, vomiting, loss of appetite. Okay, so this kit is Indian patent published, and we are happy to announce that US patent is granted to this kit. Then there is a second kit called as chemo recovery kit with Suvarna Bhasma. For this kit also, the US patent and Indian patent are published. And while publishing this kit, we have undergone one clinical trial in which in study group 67 patients were enrolled who received chemotherapy along with Ayurvedic treatment for 10 months, and in control group 57 patients were recruited who received only chemotherapy, and the time points were assessment were start of chemo, mid chemo, end chemo, post 1 month, and post 1 year of chemotherapy. And we are in the process of publishing this research work. And what we have observed that the combination cumulatively possess free radical scavenging, antioxidant, analgesic, antipyretic, anti-ulcer, and anti-hepatotoxic activities, and therefore can combat the side effects of chemotherapy by their qualities without affecting the survival of the patients. And we have observed the 4 year post-treatment survival of these patients. So we have carried out some immunological markers, cytokine studies, ROS studies in these patients, and it was observed that Ayurvedic treatment is effective as immunomodulatory and antioxidant treatment. So this is the kit which contains Suvarna Bhasma, the Suvarna Bhasmadi Vati, which has granted as US patent. It contains Suvarna Bhasma, Mauktik Bhasma, and Guduchi Sattva, Padmakadi Gruta, Kamadudhavati. So these are the main ingredients of this chemo recovery kit. Second clinical trial was carried out for oral cavity cancer patients, because we know the oral cavity cancer patients undergoing radiotherapy, they have many issues regarding stomatitis or intake of food. So this project was carried out on 180 patients, among which 115 patients were study group patients who were treated with Ayurvedic treatment along with radiotherapy, and again divided in two subgroups. That is, one group was treated only with oral Ayurvedic medicines along with radiation, and another group was treated with oral Ayurvedic medicines and Panchakarma, and 60 patients received only radiotherapy. So what we have observed that Ayurvedic treatment is effective in side effects like stomatitis, trismus, xerostomia, dysphagia, nausea, excessive salivation, local pain, and trismus. Not only that, we have done complete immune profile of 50 patients among these projects, and the samples were sent to Dr. Shubhada Chiplunkar madam's lab. And what we have observed that the immune status effectively improved in the patients treated with oral Ayurvedic medicines and Panchakarma. A case report of one of that patient is published in a renowned journal, and now we are in process of publishing the complete data. So this is the radiation recovery kit, which contains Yashtimadu Ghruta, Suvarna Basmadi Yog, Kamadudavati, Anantavati. There are some gargles and nasal applications and local application with Yashtimadu Ghruta. Then we have started, these two projects were based on side effects of chemotherapy and radiotherapy. But there is one more area where Ayurveda can contribute, that is to increase the disease-free survival. So in cancer, especially in triple negative breast cancers, which are very aggressive types of cancer, and HBOC, that is the breast and ovarian cancers, which have BRCA1 and BRCA2 mutation, they are very aggressive type of cancer, and the patients suffering from this type of cancer have a lifetime very high risk of developing recurrence and metastasis. So in that regard, we have the previous study insights that our patients, 68 TNBC patients who were treated with oral medicines, Rasayana and Panchakarma, we analyzed their data, and what we have observed that in general, 80% of triple negative breast cancer patients had recurrence or metastasis during first 3 years. But our data showed that there are very minimal number of patients who had recurrence who were treated with Ayurvedic treatment. And there were some remarkable case reports of HBOC and TNBC. So on the basis of these publications and on the basis of these insights, we developed two projects about study of survival of TNBC with or without BRCA1 and 2 mutation in breast cancers. So we observed the 5-year survival in these patients. We treated them with oral medicines for 3 years and 4 sets of Panchakarma of 14 days each. So here you can see that the study group patients who were treated 33 and control group patients 22. So you can see the graph that definitely the survival of study group patient is higher than the survival of control group patients. So these are the two kits, triple negative breast cancer kit and BRCA1 BRCA2 mutated breast cancer kit. So the US and Indian patent is published for these kits. Then we have published total 17 original articles which are available on our website. You can go through it. 9 case reports in well-known journals. Then some articles about standardization and quality control of various Ayurvedic medicines. There are 10 articles are available. 7 review articles, 11 abstracts, and we have one book of remarkable case reports which contains 30 case reports which are of aggressive type of cancer. This is our own publication. And here I can just show you how we see that whether Ayurvedic treatment is effective or not. We compare the relative survival of our patients with the reported survival, and then we come to know whether our treatment is effective or not. So as academic work, we have our 9 students from our institute completed their PhD on various types of cancer, 3 completed MPhil, 1 postdoctoral, and 5 PhD students are doing their PhD. So as with the help of this experience of Dr. Sardeshmukh, Dr. Arvind Kulkarni and all our colleagues, now we are happy that from this year, we have launched one course on integrative oncology, fellowship course of integrative oncology, containing allopathy, Ayurveda, yoga, and meditation through Maharashtra University of Health Science. And this course will be 1 year fellowship course, which will start soon in the month of November. And we are happy to share our experience with all the students in this course. So this is our team. So thank you, CCRS, Dr. Manohar sir, for inviting us and giving us opportunity to showcase our work. Thank you, sir.
Thank you, madam, for nice presentation and also completing within time. But this is the mammoth work. That's what you people are doing. But summarizing in a short time, that's a challenge, but you could do it. Thank you very much. Going towards the next lecture, the next speaker, Dr. Avinash Kadam. So I will invite Dr. Avinash Kadam. Before that, I want to introduce him. Dr. Avinash Kadam is a distinguished medical research professional specializing in Ayurveda oncology with over 15 years of experience in both clinical and preclinical research. His career is marked by pioneering contributions that bridge traditional Ayurvedic principles with modern oncology. He is a head research and education at Ayurveda Rasayani Pune. He is a clinical research scientist and lead various clinical studies on Ayurveda therapies and cancer in Rasayani Biologics Pune. He is a project lead of clinical research team involved in conduct of a phase 1 clinical trial of a new chemical entity, NC in oncology. He has been resource person for various reputed bodies like WHO, and it also is being a member of various prestigious cancer societies. He is a frequent speaker to deliver talks on various topics at leading conference and workshops. He has contributed scientific writing with 31 international publications and 11 national publication to his credit. He has been part of various research projects With this short bio, I will invite Dr. Avinash Padam, sir, to please share his screen and start the presentation. Over to you, sir.
Thank you very much, sir. Am I audible?
Yes, sir. You just make full screen, sir. Your screen.
Yes, sure. So today, thank you very much for CCRS for inviting us to share our experience at Rasayu Cancer Clinic, Pune. So Rasayu Cancer Clinic is involved in treating cancer patients through Ayurveda oncology principles from last 20 years. And today we are sharing some experiences with you. So the source of the data for this presentation is based on the in-house comprehensive data management software, which is prepared by our software team at Rasayu. And more the data of more than 2,000 cancer patients is completely computerized now.
Sir,
We
just to
lost some of
disturb.
the data.
Sir, sorry to
Yes,
disturb
sir.
you. The slide is
Yes,
not
sir.
moving, sir. The slide is not moving.
Light is not moving.
And you also make it full screen, sir.
I have made it full screen, sir.
Okay.
Just a
Maybe.
minute, I will stop sharing and again I will.
Yes, yes.
Is it moving now?
No, sir. We are not able to see your screen now. Oh, start
Okay.
sharing again.
Is it visible, sir?
Yes, it is visible. Just make full screen.
Let me check whether it is moving or not.
Yeah.
Is it moving?
Now we can see
Great.
the next second slide.
Source of data, right?
Source of data.
Yeah. Yeah. So the source of data which we are presenting today is based upon the data of more than 2,000 cancer patients, which we were successfully able to completely computerized. And the parameters which we are checking here is efficacy, safety of the medicine, Ayurveda treatment protocols, patient-reported outcome measures, and various prevalence trends we can identify over here based upon the data of more than 2,000 patients which we have computerized. So there are two kind of patients actually who are approaching to Ayurveda oncology based on the experience of Rasayu.
Sir,
Different centers may have different experience. Yes, sir.
Sorry, sir. Slide is again in the second slide only now. Yeah, now this is the third slide.
So I think I should not do full screen. I will.
Okay, sir. Please go ahead.
Yeah, please. Okay. There are different two type of patients who are generally approaching Ayurvedic oncology center. Different centers may have different experience, but our experience is there are some patients, the number is not too high, but actually the number is increasing who give first choice to Ayurveda. Earlier, this patient number was very less, but now many people are coming as a first choice to Ayurveda. Immediately after diagnosing, they come to Ayurveda centers, and many of them take Ayurveda medicines with conventional therapy. And there are a few patients who actually take as a standalone also, mainly geriatric population who are more than 75, 80 years of age. Generally, they or their caretaker, the family members don't wish to go for conventional anti-cancer therapy, so they prefer Ayurveda as a standalone therapy. And there is quite a significant number of patients who first try conventional treatment, and after that they come to Ayurveda with the intention of prevent the relapse of the cancer, to improve quality of life. There are quite a good number of patients nowadays coming to our clinic who has been proved to have chemo resistance. They are no longer responding to chemotherapy, especially the stage 3B or stage 4 cancer patients who have extensive metastasis disease and who patient who has relapsed disease. So this patient generally present with chemo resistance. So this is the category of patient which we are seeing increasing nowadays. There are patients with end of life palliative care also. Generally, they try everything, and once they exhaust with the therapy available, when they are told that okay, nothing can be done with now, and just have to go with morphine, so they come with a hope to Ayurveda. So these are the categories of the patient we generally receives. We will see the statistics of that. Uh, so we generally do a survey of each and every cancer patient who come to us. So this is the survey of last 2 year patients which we analyze based on our software data. So there are about 20% of the patient who actually come to Ayurveda Oncology Center with a hope of curing cancer. The reason might be many, like some don't respond to conventional therapy, some don't want to go for conventional therapy. But yes, there are good number of patients who come with expectation of cure. Around 40% of the patient actually come to Ayurveda for improving their quality of life. We generally they feel that after taking conventional therapy, the quality of life is significantly hampered. So this is one number of patient. Another group of patient is those who have not got benefited from the earlier treatment. This is what I was talking about, the chemo-resistant group. They have taken all kind of therapy, and but still the chemotherapy is not working, or the patient has shown progressive disease. So this is the category of patient. There is around 17 to 18% of the patients who actually come to our center with the objective of reducing the side effects of the conventional therapy. And actually, this patient later convert to full-time Ayurveda treatment also, because once they get experience with Ayurveda therapy, they feel that okay, Ayurveda has done good for me, and after completing their chemotherapy, they continue with the Ayurveda therapy. It's not that they complete the chemotherapy and they drop Ayurveda. This happens very rarely. Then there is a good number of patients who actually come for preventing relapse, and Ayurveda has a great potential here, but this need this category of patient need to be educated more, so that more and more patient can come here to for disease-free survival. Once they have completed with the conventional anti-cancer therapies, once they are disease-free, they can actually start rasayana therapy, like in earlier presentation what madam has shown, uh, panchakarma therapy also. So Ayurveda has a great potential here, and this need to be explored further. Nowadays, there are some patients' relatives who have taken treatment with us. They approach us saying that, okay, I have a genetic predisposition for one particular type of cancer. My mother got the same. So I also want to take some treatment which will probably reduce the risk of getting cancer. So this is the category of patient who generally comes to Ayurveda center for Ayurveda oncology. So these are the top 10 cancers which we received in year 2024: breast, oral, colon, and rectum. This data actually is similar to the Indian statistics of the cancer prevalence. Next is stage-wise data. Here also we can see that around 60% of the cancer patient approaching to Rasayu were those of stage 4 disease. And if you consider stage 3 and stage 4, which we generally categorize as advanced stage disease, so here around more than 82% of the patients generally we can see here. This is actually a bad scenario because when prognosis is considered, the prognosis is not very encouraging when the patient comes so late. But again, this data is similar to the data of Indian cancer patient, because it is well known fact that Indian patients diagnosis happens very late as compared to their Western counterparts. So these are the key strength area which we identified. One is the geriatric cases, especially like what I have mentioned earlier. These patients come with multiple comorbidities. They have compromised liver function, cardiac function is compromised, respiratory system is not working properly, they have COPD and multiple issues, they are taking multiple medication, already their performance status is very low. So generally, such geriatric patients, the caretaker of this such patients usually prefer not to go for conventional cytotoxic therapy, and they ask us, okay, whatever best can be done with Ayurveda, we are okay for that, because already the patient has lived his life 75, 80 years of age now. It's okay. So this is the category of the patient which I think Ayurveda can do wonderful in this patient, because the tolerability of Ayurvedic medicine is very well. Next is cancer rehabilitation, which we feel is again a potential area where Ayurveda can show wonderful results, especially when the patient has completed the cytotoxic therapy or surgery. Patient can go for rehabilitation.
Okay.
Then prevention of relapse and metastasis, improvement in quality of life. Okay. Then we have holistic palliative care, end of the life patients coming here. And alternative therapy, there are a category of patients who actually come with the hope of Ayurveda as an alternative. These patients are those patients who are chemo resistant, or those patients who are not tolerating chemotherapy. They have taken 1 or 2 cycles and they experience very severe adverse reaction. So such patients also some of the time feel that okay, they will not continue with the conventional cytotoxic therapy, and they come. And there is a small number of patients who are having a great hope, respect for traditional therapies, and they don't wish to go for any conventional cytotoxic therapy, though the number is very, very less here. But yes, there exists some group of patients who don't want, voluntarily don't want to go for cytotoxic therapy. So these are the category of the patients where actually Ayurveda has a very great potential which needs to be further explored. So this is the experience what we like to share at Rasayu when we are treating patient. Quality of life, like what I told, 40% or 42% of the patients which are coming to Ayurveda center, they come with the expectation of better quality of life, improvement in quality of life. And quality of life is a very important parameter which generally gets neglected, especially in advanced stage patients when the hope of cure is very minimal. The patient is in the stage 3B or stage 4, multiple chemotherapy has taken, it's not working, and majority of the Indian patient lies in this category. So in such patient, actually maintaining quality of life, increasing the survival period is very important parameter, and Ayurveda medicines have shown excellent result in improving quality of life. And this is our experience which we analyze from the software data, and within 15 to 20 days patients show a very significant improvement in quality of life. We use the FACG score scale here. Each patient coming to Rasai Cancer Clinic fills FACG scales and the data is analyzed. So we can see physical well-being, emotional well-being and functional well-being are very well attended here. Up to 3 months, very significant improvement you can see, and after 3 months the improvement is stable for a long duration. So Ayurveda has a great potential here to improve quality of life, and we have published many papers in multiple type of cancers in various high impact journals, and we have demonstrated that Ayurveda therapy has the potential to improving quality of life. This paper was published in the Journal of Thoracic Oncology in the geriatric cancer, lung cancer patients. Next is quality of life for the caregivers. This is again a neglected area, and Ayurveda has very good result here. Those who are practicing in Ayurveda oncology would have experienced this. Not only the patient is happy, but the caregivers are also equally happy, because earlier the patients were not able to perform their ADLs, or what we call as activities of daily living. So they were not able to take bath. They were completely bedridden. And moreover, in India, unlike the Western countries where the caretakers are usually a hired nurse, in India the caretakers are usually the loved ones, the family members. When they see that day by day the performance status is deteriorating, day by day when the progression of the disease is happening, the patient is not responding to therapy, the quality of life is deteriorating, that gives a very negative impact on the mental health of the caregivers also. So when we start Ayurveda treatment, we have seen that when the patients start improving, the quality of life of the caregiver start improving. Patient is able to perform his activities of daily living. His lot of independence is brought to the patient's life. The performance status, what we check in each and every patient, is ECOG performance status, which starts significantly improving, and quality of life do improve. This was our observation, and we did a systematic study for that. And this was validated with the study, and we got a publication of that in again a very good ASCO publication in Journal of Clinical Oncology. This we performed in the glioblastoma patient, GBM patient. As we all know, GBM patient has very bad prognosis, and the activities of daily living are very badly hampered in that. So in this patient also, caregivers showed that they are very happy and their quality of life improved. Then recurrence risk, like in the earlier talk, madam has rightly told that Ayurveda has a great potential to reduce the recurrence. And one of the wonderful study madam has shared where the recurrence risk has came down. So So we also have similar experience. Not only we, I think any Ayurveda doctor who is working in Ayurveda oncology will share similar experience that yes, the patient who actually take Ayurveda has a less chance of recurrence. Okay, you cannot completely eliminate the risk of recurrence because cancer is a multifactorial disease and multiple pathway act at a similar time. But yes, the risk of relapse certainly comes down. And one of the important factor here is the circulating tumor cell, which is actually now multiple publications are saying that it is one of the accepted marker for in cancer relapse. So we did one study and we found that cancer circulating tumor cell CTCs are significantly reduced after giving Rasayana treatment. So this also we got publication in journal Clinical Oncology, and this is one of the very important scientific evidence that Ayurveda medicine acts through reduction in circulating tumor cell. This was a very landmark study which we performed in collaboration with lab in Pune, which was dealing with a specialty in what you call CTC. So they have specialized in CTC. We collaborated with them and we got the study done, and the results were quite encouraging. Next is anxiety, depression, and sleep. As we all know, this is a very common problem and many a time left unattended in cancer patients. And various studies are published which show that if the patient is in anxiety or depression, the total overall outcome, irrespective of whatever therapy you give, generally outcomes are poor. So multiple scientific studies have already proved that there is a good number of evidence to prove that if you improve the mental health, or in what Ayurveda we can call a sattva of the patient, if you work on sattva of the patient, the outcome, overall outcomes of the therapy is very good. There are isolated case reports also, the patient who were what you call not aware of their disease, they responded very well. So anxiety or depression, attending these factors is very important. And Ayurveda therapy, in to best of our experience, I can say it not only reduces the anxiety and depression, it also improves the sleep quality. This is also very important because if sleep is not proper, again vata vriddhi can happen, and vata can do all kind of nuisance with the cancer. Especially it can fasten the metastasis spread of the disease and all. So this also we did a systematic study, and this study was presented in annual conference of Korean Society of Medical Oncology. And here we analyze the patient with Pittsburgh Sleep Quality Index questionnaire, hospital anxiety and depression scale, and the FACG quality of life scale. So here we demonstrated that significant improvement in the global sleep quality index of the PSQI, or the Pittsburgh Sleep Quality Index questionnaire was seen. Quality of life, overall quality of life was improved. Hospital anxiety and depression scale did show significant improvement in both anxiety scale as well as depression subdomain of the HAT scale, HATS questionnaire. So this is also one important thing which actually, when if we integrate with the conventional treatment protocols, probably will improve the overall outcomes in cancer patients. Another important parameter is anorexia and the severe cachexia, where the patient lose weight, that too very fastly. Weight loss is considered as a very important prognostic indicator. Like if you keep all indicators one side and the weight loss is one of the that important indicator. We should always try to reduce the weight loss, or at least stabilize where it is. The patient is losing weight, the overall outcome generally is not considered to be good. And there is a good number of data which show that if the patient is going to anorexia, almost 25, I have read a paper where I think more than 30% of the patients in advanced cancer stage die because of the malnutrition of cancer, rather than dying by cancer itself. So indirectly, anorexia also plays a very important role. You have seen patients that slowly they stop eating any kind of food. They just depend on liquid diets or juice, and this actually hampers their overall outcomes. So our therapies within 15 to 20 days, Ayurveda therapies does show significant improvement in the diet which the patient takes. Weight loss, we are not able to reverse completely and improve the weight, but yes, certainly we can stop the weight loss. I can see the present data. Yes, there are a number of patients who show improvement in weight also. I'm talking about advanced stage patient, not about the preliminary like stage 1, 2, or 3. Those patients do show significant weight gain. But if you talk of advanced stage patients, stage 4 patients, there at least Ayurveda medicine can significantly stop the weight loss, further weight loss. Anorexia is improved, patients start eating properly, and overall outcomes, because when the patients start eating properly, weight loss is stabilized, naturally the quality of life improves. And this also we got published in one of the very reputed Journal of Cancer Research and Therapeutics, where we actually did the study on breast cancer patients, and the results were very encouraging in preventing anorexia. Another similar study which we published in Annals of Oncology, one of the most reputed journal in oncology, there we got this data published. Overall, both this paper gives a significant evidence that yes, Ayurveda plays a very important role in treating cancer-related anorexia. Geriatric oncology, like what I have earlier told, one of the very important field, very unexplored field, where actually Ayurveda has a great potential, because this group of the patient generally don't want to go for conventional therapy. They voluntarily refuse, and their caretakers also respect their decision. They come for Ayurveda, and Ayurveda has a great hope which we can offer to them, not only in improving quality of life and survival, but sometimes the patient do respond wonderfully well, and they have gone into regression also, partial, sometimes partial, sometimes complete. Okay, so yes, this is a very important field, and we did some survey studies over here, and also we analyzed patients data. So here we can see, to our experience, there were more than 40% of the patients who were having more than one comorbidity, significant comorbidity, I'm trying to say. So this is the group of the patient who actually have comorbidities, which sometimes make them ineligible for conventional cytotoxic therapies. So yes, Ayurveda show very good result, and when we studied in deep the patients with geriatric oncology, around 38% of the patient you can see over here, they were those patients who actually declined conventional therapy. So almost 40% of the patient, geriatric patient which are coming to Rasayu, are voluntarily declining conventional therapies. This is the area where actually a lot can be done, and we can offer a great to the society, especially the geriatric patient. So this also we got published in Annals of Oncology. We did the study on hepatocellular carcinoma, which we know has very poor outcomes, and this patient present with a very significant anorexia and a very poor quality of life. So here we showed a significant improvement in quality of life in geriatric patients. Again, this is a case of chemo-resistant or intolerant. Like in beginning only, I told you that there is a good number of patients who are coming to us once they have developed chemo resistance, when nothing left for them. So here also Ayurveda can do wonders over here, and we have shown multiple cases who have responded wonderfully well, who have gone into completely disease-free state after starting Ayurveda therapy. And a couple of such cases we have published also, like in the beginning, respected DG sir has rightly pointed out that yes, there are some cases of complete cure by Ayurveda, which actually need to be scientifically validated and scrutinized by peer reviewers. So, to make this validated, we submitted these cases to a very international reputed international journal, and got this case of complete tumor regression exclusively with Ayurveda Rasayana therapy. And this peer review process is, I will always remember in my life. In my entire research career, this was a very stringent peer review, because something was coming into public domain where complete disease regression has happened without conventional cytotoxic therapy. This was the first ever published evidence with any alternative therapy without conventional therapy, the disease has gone. So in public domain, scientific domain, this was not there. So very stringent review and multiple time they actually asked multiple data, and we were able to give all the data to them because we maintain a very good database, computerized database. So one of this paper got published, and this is in public domain. This is in open access journal. You can completely study this case. Another similar case we got published here. I am just giving the name. So there are many such cases, and now we are in the process. Our medical writing team is in process of getting these cases published. But couple of cases are published already, and this can be used for further publication by any Ayurvedic researchers or scholars, which will help ease them when they are demonstrating the cure potential of Ayurveda. So next is since we practice in Rasa Shastra, and more than 95% of our treatment is Rasa Shastra based, very less Panchakarma we use, mostly if it is limited to Matra Basti and all. So this is one added advantage which we feel that patient is able to take this medicine orally, even in the remotest part of the country, where they will just come once and they will get the clinical examination done. They will start the treatment, and next through video conferencing also they can continue the treatment in any remote part of the country wherever actually medical facilities are not available. So this is one added advantage of Ayurveda which can be given. Moreover, convenience is there because already the cancer patients are going multiple invasive therapies. They need to take the chemotherapy. The oral chemotherapy is very rare. So, okay, the added advantage of Ayurveda Shastra, which we did one study during the COVID-19 time, because those days patients were not able to come out of their home. And we developed a model of telemedicine that time. And based on the telemedicine protocol, we treated multiple cancer patients and we checked their outcomes. The outcomes were very similar to the outcomes which generally we take in the clinics. And we also check the patient satisfaction score, and multiple questionnaires were used in this, and we got very good results here, and this was published in Supportive Care in Cancer, again one of the very important reputed journal in oncology. Next is a safety issue. Safety generally comes when you talk about Rasa Shastra. Safety is one thing which generally comes into everybody's mind, whether Rasa Shastra is safe. Yes, we do take all kind of precautions to ensure that the maximum safety is assured to each and every patient. That's why liver function, renal function, and the basic hematological tests are done at baseline of each patient, because this is our advice to any Ayurvedic doctor who want to start with that, because generally when the patient come to us, they have taken paclitaxel, cisplatin, and multiple chemotherapy, which in themselves are nephrotoxic some of the times. So what happens when they come to us, their renal profile may be deranged, hepatic profile might be deranged, and if you are not doing the test, and after 3 months you are doing, suppose you find that okay, creatinine is high, or the liver enzymes are higher side, so at that time it might be felt that yes, because of Ayurveda medicine this has gone. So generally we don't take such kind of risk at baseline. We don't start treatment before we have LFT, RFT, CPC treatment. We mandatorily repeat those tests at every 2 months interval, and this is the huge data available with us now of thousands of patients, cancer patients treated with every 2 months of hematological and biochemical safety assessment. So this data we have analyzed now, and we are trying to do a bigger study, because this is a unique Rasa Shastra data available with any cancer clinic or any Rasa Shastra clinic in India. The huge data is very valuable, and we are confident now that Rasa Shastra treatment, if properly prepared medicines are used, they are very safe and extremely well tolerable therapy. Also, we assess the safety of each and every patient using the CTCAE criteria. The inbuilt software is having the CTCAE criteria. Suppose you are mentioning nausea, the grade of nausea automatically highlights over there, and just you have to click which grade it is as per the CTCAE criteria. This helps us a great in whenever we go for publications. So this database is safety database is available with us. And these are some of the accolades which Rasayu has. Multiple number of publication, a few of them which I have showed you or shared with you, which are were related to the outcome which we are talking about. Multiple patents we are having, and we presented our research work in various international platforms like the American Society of the Clinical Oncology, European Society of Medical Oncology, and various other such platforms where actually Ayurveda was never been introduced. So we introduced Ayurveda oncology over there, and it was very well received by the researcher in the West as well. All this happened because of our stringent effort in well documentation of the data. So this is all from my side of brief experience. We have shared what we do at Rasayu. So thank you CCRS, and thank you all for giving your valuable time.
Thank you, sir, for your this illustrative presentation. Thank you very much. Moving ahead to the next talk by Dr. Vittal Uddar. Dr. Vittal Uddar is additional professor at Department of Kaichikisa. He is the coordinator for Center of Integrative Oncology, joint venture of All India Institute of Ayurveda, All India Institute of Medical Science, and ICMR NICPR. He has a extensive experience in terms of teaching clinical more than 17 years. He's a PG PhD guide. He has published many papers, and he has been up as a PI in various projects which were funded by esteemed institutes like CCRS, AIMS, IGIB, and ILBS. He has received uh, awards from Government of Goa and AIPG Association. With this short bio, I will invite Dr. Vittal Uddar to start his presentation. Over to you, sir.
Namaste, sir. Thank you. Is it audible and visible, sir?
Yes, yes, perfect. Sir.
Okay, sir. Okay. Good afternoon to all. First of all, I would like to thank CCRS, Kerry Mumbai, respected Ravi Narayan Acharya sir, Govind Reddy sir, Manohar Kundeti sir, for giving me that opportunity to share some of the views about what exactly going on in All India Institute of Ayurveda, that is Center for Integrative Oncology. Many of us, we know that All India Institute of Ayurveda is a tertiary care hospital inaugurated by the Honorable Prime Minister Narendra Modi ji in 2017, and in Goa at 2022. And very next to this, at 2017, the Center for Integrative Oncology has been established as a joint venture with the All India Institute of Ayurveda and ICMR NICPR Noida. So, in the next year, in the April 2018, the particular OPD of Integrated Cancer Care Unit was inaugurated by our Honorable Secretary Sir, Kotecha Sir, and till then this OPD is running till now. So this is just a overall statistics of the total number of patients footfall in the Center for Integrative Oncology, near about 8,500 till now after 5 months of this data which has been entered here. So these are the major cancers which we again see in area of Delhi particularly, that is in females breast cancer and in the males lung cancer. As per the data of the leading cancers in India, it matches with that. Again, other oral cancers and astrocytoma gliomas, leukemias, hepatic and gallbladder cancers are the highest numbers. So as in a public sector, we have some challenges for the documentation, and we are working on that, and many activities also we are conducting to finalize the proper CRF. Many of them have been presented in the previous presentations. They have their own case proformas and their assessment methodologies and setup and the softwares and all. So we are working on all that, and in the at the platform of national level with the public sectors, we are working and making some workshops also, and we are on that way to finalize that and make again a comprehensive software to capture these data systematically. Many of them, they are working, but just with the reference of all those, we are in a process of making it. at the national level. So, as all the previous practitioners have also explained about the instances where the integrative approach is coming, and we are also going through the same. It is all for the same for each and every practitioner here all over the India, wherever it is. And most of the areas, like we have made some 5 categories in that. Usually, the patients comes to us in the similar ways as the previous presentations have been done. Based on our experience, we have made this. That's why these all needs to be segregated, they cumulatively be taken and made a standardized where I am doing and everyone is doing. Everything has to come in a single platform on one or the other day in the future. So that was the aim. So this in the strategy to provide primary prevention to the susceptible population to reduce their chances of developing the disease through both pharmacological and non-pharmacological, that is Panchakarma treatments. So this is the area where the patients are seeking day by day. This is increasing the awareness. But the patients are little less, and who are also coming, they will be bonding. They are following, but it is a long treatment. Longitudinally, we have to observe the patients and follow up the patients years together, minimum 2 to 3 years to 5 years, 10 years, likewise. So this is a area where a huge area where Ayurveda can be explored, but the patients are also moving to this category. And in the strategy too, the add-on therapies which we are already doing, every practitioner is doing, but there are some challenges also in this drug interaction, and such challenges are there, whether this is giving a synergistic effect or it is going to inhibit or enhance, we exactly don't know, and few of the data are available. In the last webinars also, it has been discussed about the drug interactions. Rather, as a present, considering the present situation and need for the patients, considering that the practices are going on for the purpose in this is aid the tumor size reduction and address the side effects associated with the chemotherapy, radiotherapy, and the surgeries. So tumor regression, prevention of metastasis, reduce the ill effects of the chemo and radio, enhance the chemo sensitivity, enhance chemo protection for the normal cells, and for the curative intent. This add-on therapy is usually the patients comes to us in this also category. And this is another category where standalone, many of the patients will reach to conventional treatment, and again they experiences many side effects and the decrease in the quality of life, and then they rush to the Ayurveda clinics and they want to quit that and they want to go for standalone, and few of them are not fit at all for the chemotherapy, and financially they are not sound, they cannot take that. And the these are the category of patients who comes here. Maximum patients also comes in this category for Ayurveda purpose, having a much more hope than the expected which is going on. They want to make a curative aspects, the patient will be for the intent of that. But the still we are going in this, and we explain the patients about the strength and weaknesses of the each system of medicines and where to go for a particular stage, or particular considering their the physical conditions, bala and other things, age factors, the condition, stage of the disease. We advise them to go for where exactly the Ayurveda treatment needs to be opted. Very fairly, we explain them, and the patient has to choose which is better for them. And at the last, we leave them for their choice. So another strategy is prevention of recurrence, as the previous presenters also have explained about this. This is one area which is very important in practice also, as well as in research particularly. So now in this area the researches are going on, because this is the need for many of the patients who have been treated successfully, and disease free patients are there, and they have a doubt, or they will be having a risk of developing the recurrences. These patients will come to us, and we advise them regular shodhanas and rasayanas in a feasible way, because it is a long term treatment, years to go for at least 2 to 3 years. We have to continue the treatment, and then the follow-ups also. So this is the area where again is another area. And strategy 5, chemo radio adjuvant therapies. Maximum patients will also come with this, to address the untoward effects of the chemo radiotherapy, to prepare the patient in prior, so that the patient can tolerate the effects and expecting minimum untoward effects. So that is before starting the chemo and radio also, we can start some of the matra bastis and the internal medications, krita preparations, to improvise the immunity of the patient, so that he can well tolerate the effect of the chemo and radiotherapies. He will not land into the side effects, so that he can continue the treatment and complete the treatment so that the curative intent of the treatment is achieved as far as possible. So, a few key initiatives what we have done in the Center for Integrative Oncology. I am not going in with the data in detail because we lack in the softwares. Actually, we are all documenting in a public sector. Many reasons are there. Because of that, we are now right now we are making in a documentation papers now. Since last month, we have started all that make to be online, at least not in the software, in the form of Excel sheets and other things in Pro as well as in the previous data we are extracting. And the number of footfall is very high nowadays, considering without any much this one, the patients visiting from different parts of the state to our center is increasing day by day, and the burden is increasing. That's why we extended our OPDs for all the departments and all the throughout the week we have extended it, and the number is actually doubling, and it is almost sometimes we see a patients in a single day 100 more than 100 patients. So that is the number is increasing. Accordingly, we are coping up with that, and also the documentation is a very challenging part that we are struggling with, and definitely in few months we are going to come out with those hurdles. So this is a one key initiative where in 2020 we have done some workshop on integrative management cancer. The main intention of this was to gather all the practitioners all over the India to a particular platform, and then discuss about the things, update about the things, and then make main thing is about the workshop which we have conducted to develop the 5 cancer management protocols. Rather than the protocols, we have used the word algorithms now, because based on the we have called the different Ayurveda practitioners from the all the renowned practitioners all over the India, from the government sector and the private sector also, and from Ayurveda section, and from also the conventional section like AIMS New Delhi and Tata Memorial Hospital TMC Mumbai, and many of them have been evidenced, and they have given their inputs for these. In these protocols, what we have made is we have, as per the categorization, as per the conventional system, we have categorized particular cancer, and then which are the stages in that particular stage, where the presentation, how the presentation will be, and what is the Ayurvedic consideration based on the dosha and doshas, and understand the samprapti, and then naming of those particular diseases, from which context the treatment has to be planned in particular stages, where is the lacuna, where is the strength of conventional treatments. We have kept it like that, and wherever possible we have made the inclusion of Ayurveda treatment wherever possible, panchakarmas wherever possible, shamanaushadis where possible, rasayanas and the rasaushadis also. Particularly, it has been mentioned we are trying to do that, and in the 2023 again we have made a second workshop on the same objective about to review, refine, and detailed discussion on the 5 protocols developed in the 2020. And again we have taken the inputs, because we have made the base protocols, and then we have taken another input of them, and we have made final protocols also, and these have been launched also by the different events. So I will be sharing those things in a few slides. And also we have conducted CME, continuing medical education, particularly RAV is sponsoring for that. Ministry of Ayush is sponsoring and coordinated by the RAV, where it gives it into the CMEs are conducted in each department. All of you know. So particularly they have given separate funding for integrative oncology also. Once we have done it in 2021, we may take up in for the future also about the CMEs, and workshop on data management in cancer, August 2024. We see particularly on the data management we are focusing, and we are calling the resource persons from the who are already established and they are practicing and they are documenting. So we have called them, and we have taken the opinion again in the future, like in February 2025 we have planned again a workshop on data management. So the aim of that workshop is to make the consolidated the CRF first, which can be followed throughout all the national institutes, and also the practitioners, which can be with the help of the inputs from all of them. Again, with the consent of them, we are going to do this. This is the objective. We are looking for that. So, definitely in our institutes also as a national level institute, public sectors, and the health awareness days, lung cancer awareness day, and many days also we celebrate every year without fail. So, different programs, IC materials, camps will be conducted for the patients, and mainly the awareness purposes. We are doing these things. So this is the one which we have publication, that is it has been released, the breast cancer algorithm, by the Honorable former Chief Justice of India, D.Y. Chandrachud sir, and other four cancer algorithms we are working. And now the second one on leukemia we are launching in the coming 23rd Ayurveda Day with the help of the Honorable Governor and the Minister Health, our Minister of Ayush also. And this is our journal, which is the fourth issue is coming up. So very good response we are getting for this Ayush Journal of Integrative Oncology, which is a unique journal, particularly at the government sector, at the public sectors, to maintain and the with the quality and with a good peer review. So we are starting. We have started this, and the fourth issue is coming. Very good responses of the case reports. Original articles are coming to this journal, and we are hoping to have a good, very stringent review process in future, and to bring up the good quality works which has been highlighted by the previous speakers also, which has to come. But still, as the concern is to take, these are one of the tools where we can take these our achievements at a particular platform where the conventional people also can understand in their language. So that is the only way where we are going to publish the things. So even though we are doing so much of efforts, we are also having still challenges in practice. Everyone in the integrative oncology, the practitioner might have experienced about the rejection of the conventional people because of lack of evidences. But now the evidences are coming up very well. Hope in the such journals can also come up very well with a high good quality, so that all the people of conventional people can be convinced through a particular platform. If we share them, they should not deny them, because once we do in our institute the researches, it's good in our level. When we go it into the different levels like AIMS Delhi and NCI Jajjar, we are working with them. So there in the IEC, they will, to make them convinced, we require a lot of evidences. Otherwise, they will not allow to make the researches also. And even in practice also, we have seen a very bad experiences rejecting all these treatments. If he is taking any Ayush treatment, the conventional people, they will deny the treatment. You don't come here. Such a very painful things also we have seen, and they are totally rejecting. They don't even encourage to take a single medications along with any treatments in that. But in research areas, they are coming up very well, because they are very much interested in the area of research. They are coming to us and finding out new ways to make evidence. That is only the way how we can tackle this problem. And many of the patients, even they don't tell, maximum of them I can say, the 70% of people, they don't reveal to the conventional people that they are taking Ayurvedic treatments. As we know the data, 70 to 80% of people are taking traditional medicine. This is the one hurdle which can be sorted or attended through the quality publications only, and that is the effort which we have uniquely made one journal, Ayush Journal of Integrative Oncology. So these are few of the publications which we have done: Ayurvedic research-based documentation and analysis of different cancers, particularly two cancers we have taken, and we are distributing few of the things how the awareness can be done through, because All India Institute of Ayurveda is having a great number of maximum number of patients, nearly about 2,000 to 2,500 patients per day. So for them, we are making some IEC materials to make them aware. Awareness can be given to that those people who are at least visiting our centers. So these are few of the publications which we have made: Effect of Ayurveda and Siddha Intervention in the Management of Chronic Lymphocytic Leukemia, a case report, single case reports, and case series we are trying now. Many good cases also we have seen without any intervention of conventional treatment. Also, we have very good results. Only the thing is about the proper documentation. One by one, we are going for the case reports. If we might have a softwares, we might have got very good data about the quality of life and other things. We are working on that, but till meanwhile, we are publishing the case reports. Actually, we have a cases of complete resolution of breast cancer metastasis to brain also with only Ayurvedic management. Such cases are also there. We are in pipeline to publish those things. So in this, after 3.5, now it's 4 years of standalone care with Ayurveda and Siddha intervention. Patient reporting good clinical as well as quality of life improvements, and his all leukocytes count and the graphs which we have made. I'm not going in detail with that. We have all the graphs and everything we have made throughout the 3-4 years what we have made. So that is published in the Journal of Ayurveda Integrative Medicine. And this is another publication exploring anti-cancer properties of medicinal plants against breast cancer by down-regulating human epidermal growth factor receptor 2. So that is with the help of with the collaboration of Indian Institute of Technology, Delhi. We have done some project and that has been published. And it has shown that the extract of 10 Ayurvedic plants showed anti-cancer effect against the HER2 positive breast cancer cells with some reducing HER2 expression and altering key proteins linked to the cell death. So terminally chabula, barbaris, aristrata, daru, haridra, mukuna prurins, and these things have been published. So this is role of Vardhamana Pipali Rasayana in human breast cancer cells also has been published, and it has shown the cytotoxic and apoptotic effect in the breast cancer cells as compared to the normal cells. VPR may be a strong anti-cancerous potential. That work has also been done in a preclinical study. Integration of Ayurveda in the management of multiple myeloma, a case report on therapeutic synergism that also have been published. Outcome after 16 months, improved mobility, pain and swelling has resolved. Chemotherapy well tolerated to that patient, and that was the outcome of that. And this is another publication, breast cancer mRNAs, monitoring chemoresistance and systemic therapy. So few other publications are also there. And the satellite center we have started in National Cancer Institute, AIMS Jajjar, which is a unit of AIMS Delhi only, but exclusively for cancer. It has been launched in 2022. Actually, since then we have a lot of patients coming to Ayurveda. They are seeking Ayurvedic treatment, but still we are struggling to make that model as a role model. As in Pune also, Agoli, they are working already since many years, but still in these such sectors again we are struggling for to get the references, because without any publication data and other things they will not be referring the patients. And so that is the mutual integration, and the publications are definitely needed to overcome this problem again. So this is the satellite center which we are working there. It's a initiative of Ministry of Health as well as the Ministry of Ayush. This is the one, and a few projects also ongoing in the Center for Integrative Oncology. That is clinical validation of synergistic effect of Vardhamana Pipali Rasayana along with the conventional treatment after unraveling its complex molecular mechanism of action in breast cancer from experimental model to clinical trial in collaboration with AIMS, sponsored by ICMR. Preclinical study has been completed. We got a very encouraging results. We are going to publish it. And two articles already published based on the preclinical studies. And the clinical study is yet to be started now. And another one is an open label 2-arm exploratory randomized controlled trial to evaluate the effect of Vardhamana Pipali Rasayana as an add-on therapy in the management of non-small cell lung cancer in collaboration with AIMS again. This is the IMR project, and also the PhD work done by now. We have a PG and PhD. Also, we are signing these small and at the higher level studies. So, clinical trial. Another one is a clinical trial to evaluate the safety and efficacy of Siddha Med Nandi Melugu, stage 1 and 2 breast cancer patients. We are getting clinically good results with that. So that's why it has been taken in collaboration with the CCRS. Now it is ongoing and yet to be completed. And another is development for this is again a IIT Delhi project where the early diagnostic conditions like from the saliva, it has been done, effort has been done, and it's completed, and it has showed down regulation and also found cancer associated proteins present in the salivary exosomes. It is also published. And the upcoming projects in our Center for Integrative Oncology, that is related to esophageal cancer, Rasayana. particular rasayanas we have selected for that, and it is with the NCI AIMS Judger again, and another is on the maintenance of oral squamous cell carcinoma in prevention of recurrence and management of post-radiation mucositis by ST Madhukrata, a randomized controlled clinical trial with AIST Japan and AIA. Ayurveda intervention in chemotherapy-induced myelosuppression, a cell line, and a clinical study in collaboration with NCI AIMS Judger, and a cross-sectional study to assess the knowledge, attitude, and practice of cancer patients is also we are taking up, because many patients we should know the knowledge, attitude, and practice. That is also very important. What we felt to educate the patients who are coming here, what wrong messages they have and what they are carrying the knowledge, whether it is proper or not. Again, we are going to educate them how we are going to improvise their knowledge and attitude practices. So that effort is also going on. So we have a MOU partners, that is with an NCI Judger, AIMS New Delhi, that is National Institute of Cancer Prevention and Research, ICMR, and AIST Japan, and also IIT Delhi, and Central Council for Research in Siddha. So we have right now we have MOU with these people, and in different aspects we are working in this. Only in the coming years we are expecting to make more the proper documentation with the help of the softwares, and to come up with a good clinical data, as already few of these practitioners are doing very well in those fields. At the public sector also we are coming up with a consolidated and a very documentable proformas, which can be converted into a software, and then it can be implemented throughout the national, all the institutes, with the inputs of them only we are going to take, and that will come up with a good hopes that we are going to make a proper documentations. Thank you for this opportunity once again. Thank you.
Thank you, Dr. Udar, for this overview of the activities and the ongoing research that has been happening at AYA Integrative Center. Thank you very much. Moving ahead for the next lecture, the next speaker, Dr. Madhu. Dr. K.M. Madhu is the Chief Medical Officer, Ayurveda, at Aravidyasala Charitable Hospital, Kottakkal, Kerala. He has completed graduation from BPSV Ayurveda College, Kottakkal in 1995. Joined Ayurveda Kottakkal as assistant physician. Worked at Pain and Palliative Care Clinic, Medical College, Calicut for a year as a research fellow. He has experience in cancer care in Ayurveda for past 27 years. He has participated in various national and international seminars in India and abroad as a resource person. So with this short bio, I will invite Dr. K. Madhu to start his presentation. Sir, can you share your screen?
Yeah, of course, I can hear you. Yeah,
Yes,
of course.
can you share
Am I
your...
audible?
Yes, sir, you are audible.
Yeah, okay, right. Thank you.
You please share your screen and
Yeah,
start
yeah.
the presentation.
I will share it. Yeah. Yeah. Integrative oncology. Uh, 1 minute.
Yes, please. Okay. So meanwhile, there is one question Dr. Devdutt is asking from Goa. While we are advancing rapidly with integrative oncology, don't you think it is equally important to upgrade Rog Nidan Ayurvedic pathology nomenclature, including ICD, compatible coding, creating a dual language framework so that it aligns better with contemporary oncology, thereby enhancing multidisciplinary understanding? Could you please share if there have been any past efforts or initiatives in this? Okay, I have shared the link which is developed by HMIS EHR by Ministry of Ayush, and this has the inbuilt standards dual coding system. National Ayush morbidity codes along with the ICD-10 are available. Okay, we'll take, there are other questions and panel later. Over to you, Dr. Madhu. Dr. Madhu? Hello?
Hello. Yes.
Yes, you are audible, sir. You please start.
Yeah. Okay. Can you see my slide?
Yes, it is.
Okay. Right. Good evening, respected officers of CCRS, especially Dr. Manohar Gundeti, who has welcomed me for this program. And my dear fellow speakers and dear participants. I'm very happy to be here for this seminar to speak a few words on integrative oncology, some of our ideas regarding the integrative oncology. As you know, I'm coming from Ayurveda Shala Kottakkal, a 123-year-old institution in southern India, in Kerala. When we have started our cancer clinic 25 years back, and I think we have got a very good number of cancer cases here. And also the data management system is a computerized system which we are operating here. And we have a data management system too. And in a year around 15,000 odd cancer cases are coming to our hospital from various parts of India, especially in southern India as well as the Maharashtra and other part of India also. After the total number of patients from Kerala, it is the more number of patients are coming from Maharashtra, especially the central Maharashtra, that Marathwada district. So many patients are coming here. So that is the number of patients and statistics regarding our department. So what I want to tell you is about an integrative oncology, because the integrative oncology is a coming up field in which I think the modern conventional method of system can be incorporated along with the Ayurvedic system. So that is a need of the hour in our country as well as abroad. So there are so many inquiries from most of the parts in the world as well as in India to our department regarding the integration, possible integration. See, I have been there in the Tata for a couple of months. In the last year, I have been in the Tata Memorial Hospital, which they are also planning such an integrative move. And there are so many other hospitals in Kerala, reputed cancer hospitals, whom they are planning an integrative programs regarding the cancer care. And I think I'll share some of my ideas on it. See, integrative oncology is a
Sir, your slide is not moving, sir.
yeah, that's what I'm looking into.
Okay, maybe you can
I'll do that.
undo the full screen so that you
Yeah.
will be able to.
It's been undoing. Yeah, all right. Is it audible now, or is it viewable?
Yeah, it is audible, but we can
is
see
it viewable now?
the blank is there, only the
Blank
screen.
So,
No
now
slide
is
is
it,
on.
now the slide is moving. Is it so?
But no, we can't see. It's only white screen.
Ajesh, 1 minute.
So, do you want me to share from my side?
If it is there, I think that will be good.
Okay, let me check. Can you see now the screen?
Yeah.
Is it visible?
Yeah, it's visible.
Okay, then please go ahead. I will move from my side.
Yeah. Okay. So next slide, please. Yeah, integrative oncology. As I told you, um, is a new subject in the field of oncology that deals with the different therapeutic methods to treat and cure cancer. See, this is the need of the hour because no system is perfect in the management of cancer. Even the modern system has so many lacunae that we can see. From earlier speakers has also told us about the modern systems, how they are incorporating that. So this is an integrative oncology is one of the key areas where Ayurveda can perform well. Next slide, please. See, that's the point. Okay, integration. There are possible. Yeah, right. The integration possibilities, integrating different system of medicine with different theoretical framework. This is the area where most of the modern people has the problem because they think that the different theoretical framework of our system along with the modern system may not match well. But I think in my experience, it can be possible to integrate these kind of things in a healthier way. Every system has its own merits as well as demerits. So merits of each system to be available to the patients because the patients are very important here rather than the doctors or their other problems. Patients are very important. It is very relevant in the oncology because the oncology, as we know, that the curation in the oncology is very little and more of the cases are of a palliative in nature and maintaining in nature. So I think this integration, if it is done in the proper way, will reduce the burden to the patient as well as it will be very much beneficial for all the patients because if you can integrate the proper way with proper system. Next slide, please. See, that's points to be noted in the integration. So, because when you are integrating two system of medicine, it should not be a copying of a particular system. See, we have Ayurveda, we have a system of treatment like regarding the doshic predominance as well as dhatus, etc. There are so many textual things are about our system. And modern system has a different way. So we should not copy it in the way which modern system has doing. So understanding between each system, that is very important. I think when I visited most of the oncology centers, I have seen that when you just have an interaction with the modern oncologist regarding our strengths and weakness, and if we have a mutual interaction, then that will be a very good thing because it can create an area where modern people can understand our system of treatment and the quality of the treatment as well as the strength of our treatment. See, this is what happened. I think Dr. Huddar has rightly pointed out. There are so many modern practitioners which they says that don't take any Ayurvedic medicine while doing any treatment. That's a correct thing. But if you want to understand these kind of things, we may have to make a mutual understanding with them. And interaction between the physicians involved, that is very important. And settling the contradictions too, because we have so many contradictions with the modern system. So that should be settled down properly to make a smooth move in this direction. I think it is possible because we have so many experience in the past many years of Ayurveda experience in this field with the modern hospitals. It is possible to have that kind of an interaction and we can do such things. Next slide, please. This is the area of cooperation. There are two areas where we can cooperate with the conventional system. One is the clinical practice and another one is the clinical research. Because clinical practice is very more important because the research is a different part. So these are the two areas where cooperation can be taken place with the proper integration of the two systems. Next slide, please. Clinical practice, the conventional modern system of different of the treatment is surgery, chemotherapy, and radiation, as we know, and the hormonal therapy, etc. are there. And majority of patients opt modern remedies. That is also a fact. In our country, I think most of the people opt modern treatment as their first line of management. That is quite natural. Still, there is a n number of lacunae in this system itself. So there are a good opportunity for Ayurveda to perform in this condition because there may be so many lacunae in modern system of medicine. I can tell you regarding that. And also our system has some strong points in this kind of thing. So if you have a good integration with the modern system, I think the All India Institute of Medical Science or other systems, Tata Memorial Hospital, that's sort of a good hospital. If they come up with such ideas, I think that will be a role model for the entire country. I think it is going on right now, but it has to be speed up. Next slide, please. Thus, areas in integration required is one is management of residual disease. That is very important. And managing the side effects of conventional therapies and preventing recurrence. These are the three key areas where Ayurveda has a very good role, apart from the curative management. So these three areas, I think we should have to be concentrate more to make a good integrative system in entire country. So management of residual disease, managing side effects of conventional therapies, and preventing the recurrence. So I will tell you with one example for each of these areas where I think we can perform well with modern system of medicine itself. It is possible to have a such give and take policy. Next slide, please. Next slide, please. Yeah, yes. Preventing the recurrence. The clinical chance of recurrence is very important in the after the conventional therapy. So most of the patients will be stressed, expecting a nearby recurrence. Example, triple negative CA breast cases. It's a very common thing that may have recurrences. So that patient will be expecting recurrence in a near future itself. So they may be stressed enough and also may have and the modern system cannot do anything in that preventing such recurrence. Our Rasayana Aushadas has a role in managing such things. When you just opted for a long-term management, I think it has a role. We can do that, and we can apply our Ayurvedic principles in this kind of treatment. A long-term treatment is preferred in this kind of things, and I think we can give the medications as well as particular diet, that is Pathya Pathya, and the viharas also, that that daily routines, etc., that we can explain to the patient, and we can do such things. Next slide, please. The preventing recurrence, I can just show you an example. 68-year-old patient diagnosed as CA endometrium in 2018 came here after doing the surgery, radiation, and brachytherapy, and had physical issues, so many physical issues. And he has been treated with Ayurvedic medicines from 2019 itself to 2025. Right now, she is here. And recurrence was prevented and the quality of life was improved. This is an example where the recurrence can be prevented with Ayurvedic therapies. So this is a very important thing. So in most of the cases, especially this triple negative cancer, breast cancer cases, CA endometrium cases, CA cervix cases, even CA stomach cases, there are chances of recurrence. So if we give the medications to a larger time, with the proper rasayanas to be selected, and we can also incorporate this panchakarma treatments as well as Sveda karmas, Neha karmas, etc. The preparatory treatments, etc., can be done accordingly and according to the patient's condition. And each patient to be individualized first and do the treatment according to his or her physical condition. This is one of the examples. Next slide, please. See, management of residual disease. This is very seldomly happening in our clinic because the modern system of treatment which they are treating with chemotherapy or radiation, which they may have treated the disease in a partial way, and the disease is there are residual diseases. Example, this brain tumors are there, and so many other cases also are there. The residual diseases after conventional treatments or recurrence, it is there. So patient may find it difficult to repeat all the aggressive therapies. When you just give a chemotherapy or radiotherapy to a patient, and now immediately after that, when the recurrence happens, what will be the option? Because the patient may not have much options for going chemotherapy or radiation, but they are not interested in going such a way. And in an earlier speech, one of the speakers has clearly mentioned about the geriatric oncology. This is also very important here because the geriatric oncology patient usually in our experience doesn't like to go for a modern therapy, in recurrent modern therapy, due to various reasons, because physical problems will be there, mental problem will be there, social issues will be there, even economical issues will be there, so many other problems will be there. So this is the right from our rural part of India, it is a problem which is happening now. So that in that area, Ayurveda has a role to play. And patient may find it difficult to repeat the aggressive therapies, and the physical health may not permit such things. When you do such aggressive therapies, and immediately after that, I have so many experience like that. Because when the patient is undergoing chemotherapy, and after that chemotherapy, 6 cycles of chemotherapy, after 1 or 2 months, again the recurrence is happening, and this recurrence they cannot do anything. So this is the problem, and where Ayurvedic medicines can interfere in this in a very better way. Next slide, please. This is one of the examples which I have treated recently. A 13-year-old male diagnosed as presacral medulloepithelioma with lung metastasis in 2019. He underwent chemotherapy and radiotherapy and presented to us with a residual disease, because the lung metastasis itself is a big problem. Now he is undergoing the treatment in our hospital, and the scan shows a stable disease, even though it is not a curable option, but the stability can be attained with Ayurvedic medicine, and the patient is leading a normal quality of life. This is one of the examples of treating the residual disease, because this is very important. And there are any number of patients I can see you regarding this residual problems, residual managements. So this is one of the area where Ayurveda can perform in this area. So number one is preventing recurrence, and number two is residual management. Next slide, please. Managing the side effects of conventional treatments. I think most of the doctors who are treating oncology cases have the experience of managing these side effects, because the causing physical and psychological impacts. Because most of the people who are undergoing modern conventional therapies have the side effects, and they even says that the disease has a better role than the this post-treatment condition, because severe problems, severe neuropathy, severe hair loss, severe fatigue, severe cachexia. So many problems are there. So these kind of things are caused by this treatment. Apart from that, there is a less addressed it is less addressed by the conventional system, because when you go to a modern oncologist, they will give you some multivitamins or something like that. But that is not the end of the problem, because the patient has a big problem for maintaining this conventional side effects. I have a patient. I can tell you one patient who has undergone modern therapies for his colon cancer, and he has been done with a hemicolectomy was done. Afterwards, a radiation was performed to him, and after the radiation, what happens was he had a very severe colitis, and the severe colitis has caused him so many problems, because when after undergoing this radiotherapy, his bowel movements, he has a bowel movements around 20 to 30 times a day. So he lost his job, and he has so many other social problems too. So this is one of the problem. Even though the disease was cured at that time, the problem was he could not go to his home. He could not go to for his work, etc. So this is very severe problems which the patient finds is very difficult to manage, and often view this as a more difficulty than the disease, because patient finds that the disease is much more lesser problem than this treatment. This is a very real problem which is happening in our country. Next slide, please. So management of side effects, I can tell you one of the example. This was a 64-year-old lady with a carcinoma of breast in 2019. He underwent all the modern therapies like mastectomy followed by chemotherapy and radiation. And she has presented with a severe peripheral neuropathy. Even she could not walk properly, and she could not do her own works. So this was on Ayurvedic, and now she is on Ayurvedic medicines. We have done Ayurvedic oral medications, as well as we have admitted her here and done all the Panchakarma treatments which were adaptable to that patient. And peripheral neuropathy was reduced very well and able to prevent the further recurrence too, because this lady is doing very well, and she is undergoing our treatment with such oral medications, as well as so many this kind of inpatient treatment too. So this is one of the area where the recurrence can be prevented. Moreover, the quality of life of the patient and all these kind of problems which I have mentioned, this preventing recurrence, this management of residual disease, as well as the managing the side effects of the disease. All these problems, the quality of life of the patient is very important. Even in the international scenario, they say that the quality of life of the patient is much more important than any other lab parameters. So that we can assess the quality of life with using so many scales that is possible. And we are also using that kind of scales in our hospital for assessing such situation. Today itself, I have a very good example, so I can just tell you that very happily. One of the patient came here with 85 years of old with carcinoma cervix. She could not do any such modern treatments. Even the surgery was performed, and after that there was no other treatment was performed. She has a profused cervical bleeding, as well as she was she was in a bedridden manner. After undergoing one month of our medication, proper medication, she could able to move around. And I saw the patient now, and she could move around. She could do all her activities. So this is an area where that geriatric oncology patient, it's a very good improvement which we observed. So that is why I'm telling you that Ayurveda has a role, because Ayurveda can certainly improve the quality of life of the patient with our oral medication, as well as the inpatient management like panchakarmas or any other sweda karmas. That is also a part and parcel of the disease. And clinical research, that also we should have to mention right now. I'm just sharing some of the experience of integrative research programs in palliative care, because you know that palliative care is a very good area where the state of Kerala has improved in the palliative care management. Because in Kerala, every nook and corner of the state, we have palliative care units, the modern palliative care units. Currently, our state government has made Ayurveda was included in the palliative management, and the government sector as well as the private sector, the palliative care is going on in a very good manner, and most of the people are getting benefits from Ayurvedic medicines also, along with the modern treatment. So the palliative care networking is very important in Kerala. I don't know what happens in the entire India, because I have gone through the national statistics. I see very distressing one, because 90% of 90 or more above percent of patients who requires palliative management doesn't get palliative care in India. That is a problem. See, this is very, very grave situation which we have. I think most of the states should adopt palliative care as a policy, and also they can incorporate Ayurvedic system of treatment in the palliative management, because the quality of life improvement itself can be taken care with Ayurvedic management, along with the conventional modern therapies like when they are giving morphines, tramadol, etc. for the pain management. We can give certain medications along with those medicines which can improve the quality of life. So I think every state in India has to approve such things as a palliative management, because I see so many patients, not from Kerala, not from other states. I see so many patients who requires palliative care, but they are being deferred from that because they didn't get such things, especially in the rural areas. So this is one of the grave situation. Next slide, please. See, this is one of the studies which we have undertaken in Calicut Medical College, which is a very good center in Kerala. Study on Misragasneham in morphine-induced constipation, and study on Shadadaudakritam in radiation-induced oral mucositis, and study on Vishwamritam, a Arishtam product in managing anorexia in cancer patients. These are the 3 studies which we undertook in the palliative care clinic in Medical College Calicut, along with the modern people. Next slide, please. And the study on efficacy of Misragasneham in morphine-induced constipation. Constipation is a major problem in the patients who are taking morphine for the pain management. So it was decided to study the efficacy of Misragasneham in this condition. And this study was published in an international journal, Journal of Pain and Symptom Management, which is being studied, published from United States of America. Next slide, please. And Misragasneham, which we have given 50 patients were taken for the first phase of study in comparison with soft senna. And second phase of the study was done in 100 patients. And 70% of patients who reported a very good relief. And advantage of this drug is economically cheaper, and with a smaller dosage we can give this medicine. So the constipation can be relieved. And in our clinic itself, we are using this Misragasneham very randomly. And it is a very effective medicine which we can give to the patient in a very smaller dose. It can reduce the constipation. And thereby, this constipation, if you relieve the constipation, naturally, most of the patients will have a good relief for them. And also, regarding our signs, the anulomia which may have to happen in the Kevalavadika case, it is very important to do such things. Next slide, please. And Shadradaudagram in the management of radiation-induced mucositis, that is also very, very common, because radiation done on oral cancers can cause severe mucositis, by which the patient finds it difficult to take food. Because when he or she finds it difficult to take the food, naturally there may have weight loss and other cachexia conditions. So this is a very great problem where the modern conventional system of medicine has no good remedy to give, even though they are giving lignocaine as a conventional treatment. But I think this medicine, the Shadavadakritam, is a very effective medicine. The study was conducted in comparison with lignocaine viscous. Next slide, please. This total number of, it was a very small study even. 22 patients were studied, 6 patients got relief with Shadavadakritam and 4 patients relief with lignocaine. And number of patients recorded relief with equal relief is 5 patients. And I think this, even though it's a very small study, we are giving in our own OPD in a very larger manner. Even in the oral mucositis as well as the anal mucositis, it is very important to give such things, because this is a pitta shamana drug. The Shadodrita is a pitta shamana drug, where I think it is very effective in managing such things. So we are giving it in a very big way. Next slide, please. And the study of Vishwamritam in anorexia in cancer patients. Anorexia is a main problem in most of the cancer patients, especially in the cancers of GI tract. It's a very big problem. And Vishwamritam is an Arishtam preparation which is being prepared in Ayurveda, is indicated in this purpose. So we are giving this medicine in a specific dosage. And this study was conducted there, and it got good relief also. So we are using it in our OPD part. Next slide, please. Even though these are all these studies which have been done is a very small studies, in earlier times we have done that, it was not at all published, but the thing is that the effect which we are getting in our routine clinical practice is very good. So that is why we are opting such things. So this is one of the areas I think Ayurveda can improve the quality of life of the patient by thereby giving such medicines. Along with the modern treatment itself, we can give such medicines. Next slide, please. Let me conclude my talk by it may be a possible option to integrate various system of medicines in different areas, because as I told you with an example, 3 major areas where Ayurveda can cooperate with the modern system in the integrative process. So I think in the state government as the central government, they are planning such an integration in the healthier way. I think that is possible and beneficial for improving health status of cancer patients. It's very important, because when you adopt Ayurveda as a main role in the cancer management, naturally the patient's condition will be improved. And if you have a good interaction with the modern people also, then more and more number of people will get the benefits of Ayurvedic management. So this is what we want to share a message with you. And I thank Dr. Manohar Gundeti and as well as the CCRAs for giving us such a good opportunity to share some of our ideas here. And I thank you very much. Thank you very much.
Thank you, Dr. Madhu sir, for nicely
Thanks.
presenting, and I appreciate that you were within the time, although we are running late according to our schedule. Although we are planning our panel discussion, we have 3 panelists, Dr. Zankana, Dr. Sharad, and Dr. Pankaj. So, although I think it's now 4:42, we'll be uh, throwing one question to all the 3 panelists. Dr. Pankaj Vanjar Kedkar is from Dinanath Mangeshkar Hospital, Pune. working in the integrative medicine department. Dr. Sharad Polte is a professor at National Institute of Ayurveda and also working in integrative Ayurveda clinic. And Dr. Jankana Buch, she is chief medical officer again at Apollo Ayurveda Bangalore. So my question for the three panelists is that you people are working at different settings like government and private and NGO sort of settings and corporate settings. To start with, Dr. Pankaj, are you there? Dr.
Yeah.
Pankaj Vandiarkhetkar?
Yeah, namaste.
Yeah, namaste. So to start with you, Dr. Pankaj, can you, because we had last four lectures.
Dr. Manohar,
Yes.
just one thing. Can we stop screen sharing? We can't. I mean, that clarity is not coming.
Oh, sorry.
Can see you.
I will stop my.
Yeah.
Sorry. I'm sorry for that.
No worries, doctor.
So Dr. Pankaj and Dr. Dankana and Dr. Sharad Pote sir, we have heard now four lectures which talked about their experiences at different settings. Like one is in an IA, that is government setting, and another is an integrative cancer hospital, and another is a private setup like a Rasayu clinic, and one the Ayurvedic setup in Ayurveda Pharmacy Kotakal. So we have heard about the experiences of their cancer management in integrative approach and per se in standalone also. You have a different backgrounds, all three people you have again. So I will ask you one question to all of you like what are the challenges that you face when you work in an integrative oncology setting? And also what you feel that what is the scope and what is the opportunity for us as a system of Ayurveda in the integrative oncology in coming years. So I request and I may start with Dr. Pankaj and I request all the speakers to stick to the time, maybe 5 minutes each. I'm sorry for that, but we are well behind the schedule. Over to you, Dr. Pankaj.
Yeah, thank you, Dr. Manohar. Thank you for this opportunity. And this integrative cancer care itself suggests that it is an integrative effort. So when we started with the metastatic cases or those who have serious side effects, and due to the side effects, the primary treatment need to take a break. For example, if radiation is there and due to radiation reactions, if the patient needs to have a radiation gap, which may not be advisable in view of the disease. So we started from that point. I mean, whatever trials or whatever the clinical cases we started like 12, 15 years before, we started with the metastatic patients or stage 4 patients or those who are having reactions. And thereafter we evolved because, see, what I understand is no one is having any questions on our system of medicine. No one is having any question on our drugs. The problem is that do we know our drugs in a better way? So because these are ultimately interventions. So by intervention means that suppose there is an oncosurgeon, so he has surgery as intervention in his hand where he knows everything in out. The medical oncologists, they have chemotherapies, radiation, they have the radiation aids. So as the Ayurvedic oncologist, when we work in these kind of integrative setups, do we really know about our drugs? So they do not have problem with using your drugs the way you want. The problem is that if you know and if you take the responsibility of the drug, whatever is being procured, and the effect or side effect of the drug when we use in combination is more important. Once we start these kind of practices, and in our center everything is in the open platform. So open platform means everyone can see whatever I have prescribed. I can see what other consultants have prescribed, what are the plans. So this is the open platform system, and that's why everyone is open for the details of the drug, the doses, which form is being given, and then we discuss these cases in our weekly tumor reports also. So this is how the integration started. This is how we build the things. I will tell you what it exactly means by knowing the drug, because we usually discuss that these are our medicines or group of medicines or whatever. So for example, say take simple example of Vangabhasma. When we talk about Vangabhasma in any cancer patients, do we really know which Vangabhasma are we using? Whether, because Vangabhasma has three different references, what we call as part of Bhasma. So one is Kumari Swaras Marit, another is Apamargakshar Marit, another one is Hartal Marit. Which particular type of Vangabhasma we are using for our patient of a particular system. I may require Hartal Marit Vangabhasma for certain type of cancer. I may require Apamargakshar Marit for a certain type of cancer. So if we do not know what exactly we are using, and if if there are some consequences because of the same, then we should shoulder the responsibility also. So that is what my experience is. If we are having good control of what we are using in what patient, and if everything is clearly written, then there is much larger scope than what we are discussing. And one thing which I have seen at both the centers, I work in an urban center as well as the rural center, the most of the patients, they just send their reports across. They get medicines from some Ayurvedic centers or Ayurvedic even doctors, and then those medicines which are being shared by our colleagues, or maybe those who are not even trained in Ayurveda as a formal education. That is the main problem of the allopathy doctors, that they say that they're on the basis of some report, on the basis of some continuation sheet, how can Ayurvedic medicines be given? So, Dr. Manohar, through you, as because you are like a nodal person for all these meetings and particularly this seminar, I would like to make an appeal to everyone that let us stop sending these kind of medicines across, because now I see a lot of doctors over here. They are working in integrative oncology. Let us prepare a pool of doctors over here. So I'm sitting in Pune. Why I should treat some patient in Delhi? Dr. Hudar is there. I can directly send that, okay, this the integrative oncology center is there. Why I should treat a patient in Chennai? And so if at all we need to do through a kind of teleconsultation also, it should be done in end of life settings only. Otherwise, if we start practicing online or with the reports, or just seeing reports, or at times just relatives go and come back, so this is going to give us a hard time to integrate with the allopathy system of medicine. Because yeah, if we just keep on doing this, so we need to own the responsibility of what we are giving. Every single medicine we should have the accountability. So that is what my submission is.
Thank you, Dr. Pankaj. Your points are well taken about the standardization of the drugs and the quality standards, and also about the remote monitoring and the exact physical monitoring for the patients who are undergoing the treatment. Thank you very much. Your points are well taken. Going ahead to Dr. Zankana, over to you about what are the challenges that you face when in an integrative setting, and what do you feel that what is the scope and opportunity for us as a system of Ayurveda in the integrative oncology in coming years?
Namaste, Dr. Manohar and esteemed participants. I have seen working in this system at Apollo Ayurveda in 2005. It was founded, making a foundation for India's first NABH accreditation. So the setting for standards of quality and safe care was already there. We built upon integrative cancer rehabilitation in 2012, and it has been a decade and a more that we are moving forward, bringing in precision Ayurveda and integrative medicine in a lot more rigorous way than we began. With our presence in other quaternary care hospitals and a 650-bed dedicated cancer hospital in Bangalore at Sri Shankara Cancer Hospital, with a focused department of integrative oncology. And last 3 years, actively working with the oncologist at Apollo and other hospitals, I feel that in my interactions with the oncologist and patients, when it comes to dealing with the situations, there are 4 scenarios which I think are very important that Ayurveda fraternity should keep in mind. I did hear everybody with fantastic work that is being done with a lot of publications at ASCO, ESMO, from Rasayu, from Vinita ma'am, uh, and everybody who spoke. But I feel the biggest challenge, first one, lies in common parlance of scientific rigor and level of evidence. When we publish outside, when we speak outside, we are asked to talk about the levels of evidence. So I think the case reports or case series, etc., are fine. But together as a pool, as Dr. Pankaj was mentioning, we need to identify institutions, individuals, clinicians, and a workforce which works towards building scientific rigor and clinical evidence, which brings in lot more robust data of clinical trials across the cancer care spectrum in a very systematic and structured way. The second important thing which I feel, which Ayurveda needs to start preparing for now, as we can see that institutions and everybody's focus this year is on integrative oncology. How prepared are we? So, workforce and training. Our clinicians through proper training, our nurses, paricharaks, the hospital setup, everything to be ready in terms of taking care of cancer patients. Right now, we see very few privileged clinicians only taking care of oncology. But if precision Ayurveda and Ayurveda has to contribute to this, we need to work towards building a workforce and training. I do also see the third very important point is about policy making in Ayurveda. We can see there are scattered references on oncology. So I think Ayurveda and our policy makers and all stakeholders need to come together to build robust policy on oncology, and which spans into the entire care spectrum. And the second uh, and the last point, which I feel which I would like to say, is on clinical integration. So while we, as a private practitioner and in a corporate hospital, I do find like extremely open oncologists who come across, who refer, and we work together in various areas. But I do feel also as institution, as Dr. Pankaj was mentioning, the government institutes, all colleges, that clinical integration in terms of across the specialties of cancer has to be a lot more clearer, and it has to be well defined when we work in these areas. So I feel these are the four areas in order of priority. I would like to convey that scientific rigor and evidence is most important, building workforce, building towards policy and quality, and clinical integration at all levels. These are the things that we need to focus on. And I do find them as the challenges. If these are kept in mind, we would be able to contribute effectively. Thank you.
Thank you, Dr. Jankana. A perspective from corporate sector when you are working in integrative oncology. Thank you very much. Now I'll move ahead to Dr. Sharad Porte, sir. He's a professor at NIA and also working in a department of integrative oncology. Sir, your views on what are the challenges that are in the field of integrative oncology, and what is the scope? What do you feel, sir?
Thank you, sir. Thank you, Manohar sir, Govind Reddy sir, and CCRS, and all the participants. We started the integrated oncology from 2018, and we started it from zero patient in OPD, and nowadays we have at around 25 to 30 patients per day in our oncology units per day in OPD, and we have also some patients. We admit some patients in IPD also. Um, and what I feeling, sir, most of the oncologists, some are oncologists are positive towards Ayurveda, but most of the oncologists have less awareness about clinical ability of Ayurveda, and they said that they doubt about the Ayurveda, and they feel that if there any Ayurveda medicines can work in cancers, so such type of most of the oncologists also are there. Some oncologists are there. They are very positive and cooperating with us for integrative purpose. Likewise, Lalit Mohan Sharma is there. He is a senior most oncologist in Mahatma Gandhi Medical College. He is very cooperative. But such type of oncologists are very few, and most of the oncologists have less awareness about the clinical potentiality of Ayurveda. And second is what that we have less clinical evidence of drug-drug interactions of Ayurveda with modern medicines, and most of the oncologists feel that there is need to study on drug-drug interactions during or while going to integrative approach in cancer patients, and uh, and most of the oncologists doubt that Ayurveda have less clinical evidences of particular drug for particular adverse effect. We have also less clinical evidences. There are not so many evidences that particular Ayurvedic drugs is good for particular adverse effects, and all those treatments what we are giving to the cancer patients, it's based on our experience. It might be it is different mode of treatments by me, and it is different mode of treatment by Dr. Pankaj sir, and it is different mode of treatments by RTCSE Pune, and it is different mode of treatments by Rasai Clinic Pune, and it is different mode of treatments by Udar sir. So there is need to uniform the mode of treatments in oncology. For that we tried and we organized the core cancer conference in our institute, and tried to 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 uh, to prepare uniform protocols, but it is very difficult to prepare the uniform protocol as we have the less clinical evidences. Even in preclinical, we have also less preclinical evidences on the anti-cancer level. I cannot say that these drugs have potential clinical evidences. These Ayurvedic drugs can significantly work on these particular type of cancers. That's why what the oncologist saying that you give us the evidences, preclinical evidences, strong evidences, so that we can go with hand in hand for clinical trial, so that we can create the uh, the proper clinical evidences in field of the integrated oncology. In spite of these challenges, we have also scope. What are the scope that we have some standalone patients who are not physically fit for chemotherapy and radiotherapy, and where we are doing well. Patient are with patient are still with disease, but we are able to stand still that inhibition of cancer's growth or cancerous growth for some extent. And we have also some patients after conventional therapy they came for to avoid the recurrence, and we also published some case studies also, ovarian cancer and breast cancers. In some cases we published in PubMed journal and some other journal also. This is the area, but we need to do work more and in multi-center level, in large level, because one study cannot prove, one study or one case cannot prove the efficacy of that Ayurvedic therapy. So we need to extend our work from case to clinical study in field of recurrence also. And we have also very good result uh, for the tolerance of the chemotherapy. We have some patient that some oncologists sent to us during the chemotherapy, and we started the Ayurvedic therapy within the two dose of the chemotherapy. Means uh, means uh, if the chemotherapy is around 21 days, we start we continue the treatments from date 1 to 19, sorry, 20, and uh, and day up we skip the day up chemotherapy. And why I saw that the chemotherapy is well tolerated in the patients. So these are the some areas we are going doing we are doing well. But we are along with the some challenges, we have also some challenges, but also we have also scope. So we have to need to create more data and more evidences. That means preclinical evidences also and clinical evidences also. Without preclinical evidences and clinical evidences, the modern oncologists not cooperate us and not respect us. Thanks, sir. Over to sir.
Thank you, sir. I think you mentioned the points like again create the evidence, that is again very much important, that and that ultimately warrants that we all people who are working in the domain, the robust documentation is very much important, and so that we are generating evidence that, and rather that should be under the clinical audit, so that the quality check will be there, and also the culmination will be the publication in a peer reviewed journals, so that the other side experts will be happy to know the things. Okay, they will be ready, as Dr. Pankaj was mentioning, they are open, and even Dr. Jankana mentioned, and Dr. Vinita Madam is there. So they are working with oncologists. We are all working with oncologists. They are ready for the things to accept. But I think how much we are prepared, this is the question. And I think we are working very rigorously, everyone at their own end. But I think this should go a long way. In coming years, we'll have a picture that okay, both the systems are at a par and working for the benefit of the patient. There are a couple of questions, but I will not take because I think we have exceeded a lot time. Our Deputy Director General, okay, Dr. Pankaj, you want to?
Yeah, I just want to add one point to what Dr. Pote said, that even though, I mean, it is not necessary that we should have only level one evidences. We can start with even single case reports, case series, long term follow ups, because ultimately this is going to create the evidence. There is no direct journey of yeah, in any, even if you take any conventional oncology things, still there is no direct journey towards level 1 evidences. So we can start with level 4, level 3, whatever, but at least let us share our data. Now we have our own journal, AJIO, so we can start publishing from there. So it is not every time mandatory that we should go with the preclinical to level 1 and then only, because those who question, that is a good thing that we should improve on our side. But most importantly, we should start publication of single case with the precise follow-up with all investigations together, and the case series are also a good level of evidence. That is what I think.
Exactly. N1 is quite important, as you
Yes.
said. N1 is there, and every case is important in terms of when we talk about disease like cancer. So thank you very much. So what I was mentioning that there are a couple of questions, but we'll not take. But we are with us our Deputy Director General Dr. N. Srikant with us. So I request our sir to please give the concluding remarks. Over to you, sir.
Okay. Good afternoon. Good evening, everybody. I think
Good evening.
since
since I think 2:30, all people are really keenly observing and listening to various interactions and various lectures of various experts, and I was also listening. It is an excellent. Dr. Manohar and Reddy, you have conducted this in an efficient way. I think we had a great interactions today, right from Dr. Vinita Deshmukh Vedam, Dr. Avinash ji, Dr. Gudar, Dr. Madhu, and the panel of experts. I think the three of them excellently. I was keenly listening to Dr. Pankaj ji, Dr. Sarath sir, and Dr. It was an excellent suggestions we got, and this is a because this is very the integrative oncology. Actually, if you see the global accept this one, the trends, particularly in healthcare seeking trends, if you see, and previously, I think 10, 20 years before now also, various publications now we are getting on the healthcare seeking trends really towards the traditional medicine across the globe. If you see that the trends are really changing, still the thing is the most of the patients who approach the traditional medicine or they classified across the globe. The publications say that they're the chronic diseases which are refractory in nature, which are not non-life threatening conditions. Second one, the diseases which are life threatening and also refractory in nature, like cancer, HIV. Previously, the HIV epidemic, we have seen such diseases, and these are the two class of people. They are visiting the traditional medicine, not for Ayurveda in India. Okay, the global trend I am telling, and these are various issues. Why they are coming? Sometimes, most of the times, they are coming from different purposes. In the both life-threatening, like cancer and other diseases, non-life-threatening refractory conditions like rheumatoid arthritis and other diseases which are degenerative diseases, cognitive and mental disorders, various things. They're coming as a standalone Ayurveda for the management and treatment of disease. That was one option. And the second point, they are also coming for improvement of the quality of life, not the main line of treating cancer or treating HIV. They come for improve the quality of life and manage the symptoms. They are also coming, and some are coming actually knowing the prevention and the general health promotion. They are coming. These are the three types of classification the global reports, particularly we can see, including the cancer management trends globally. And this here, the integrative oncology, it's an excellent thing, and CCRS has been working. But here, what our experiences since I think late 80s and early 90s, CCRS has taken some good work, some experiences. I have listened from Dr. Jankana and Dr. Pankaj sir and Dr. Our Sarath sir and others, Vinita madam. I was listening to them, and this that we have various experiences we have got in particularly in integrative oncology. The lessons we understood and we learned and we need to do something is very important with all your cooperation is the thing, the experience. One of the things in early 90s and late 80s we have done some work, excellent work of around 400 cancer subjects in BHU. Manohar may be aware about this report, and the Professor G.C. Prasad were in Ayurveda CCRA's clinical research unit in Benares, Indian University. They followed the patients of the radiotherapy who are undergoing that time, sir, long before. Many scales were not there, many assessment criteria, many technology, many markers were not there at that time. Then they have done excellently observed that patients who are coming to Ayurveda after radiotherapy, only radiotherapy, chemo plus radiotherapy, and Ayurveda plus chemo and radiotherapy. All the groups they have excellently examined, and this is a type of real world evidence. What somebody was telling, Dr. Pankaj, real world evidence they generated and published. In that, we have seen that Ayurveda along with radio, along with radio and chemo, and radio chemo alone
and only chemotherapy alone. These are the various propositions stratified. They stratified the things, and overall, what they told, they add on Ayurveda in all the cases, even radiotherapy in different cancers, different stages, different histopathological diagnosis, different level stages of the cancers also they treated. And pragmatic studies. This is a pragmatic study, we can say, and that has shown that the people who are giving add-on Ayurveda actually as an integrative management. What are the benefits in all radio plus chemo, both if you are giving Ayurveda, what they are think they are improving that time many quality of life indices were not there. They have observed that the complications, event free survival period, actually lifespan very improved. That is excellent, sir. It is a good study they have given. The survival period improved. That is one. That is okay. Survival, we are improving the lifespan. Event free survival is very good, sir. We have the complication free survival. That means we are able to mitigate various complications. This is a excellent real world evidence at the earliest of the cancer management, and was actually provoked us to have an integrative oncology center in CCRS. Some few examples I want to say that taking this, we need different approaches actually to examine the efficacy. Dr. Pankaj was telling, and Dr. Jankana and Dr. Our Saras sir was telling various levels of evidence we need to create. We need the simultaneous approaches actually simultaneously, we have to work on these things actually. The thing is, now we are going a parallel type of allopathy is doing. They think we are doing our own, and we are doing a parallel type of integration. We are running. We need an inclusive type of integration. What you are all telling, that is very yeah, thing. Inclusive integration needs the patient when comes. We will the conventional people or whatever, if they are coming directly to us, if they are coming to allopathy, we should sit together and decide the treatment plan. That is very important thing, particularly in integrative oncology. In that case, we can decide this is our limitation, this is our evidence available, this we will offer, this we offer. We'll together have an excellent. We can design the treatment protocol. This is one option, sir. This require little more time. We evolve ourselves. What you all are telling your experiences. In this case, one or two examples we need to tell that, particularly in the case of lung cancer, we have done a multi-center study of Ayurveda that contain ashwagandha and some ingredients, oil, particularly in AIMS, Delhi. Professor Rath was a eminent oncologist, and St. John's Medical College, we have also get one center, and we have done this study this study we published that we can able to give the lung cancer management, radio chemo along with Ayurveda. It improved the quality of life, and that study it is also published. That is one evidence we have. And in such cases, breast cancer also relapse cases, standalone Ayurveda management that is going on in ECTRAC. That is also we have to. We will see how it will come out, and it is going on. With all these experiences, we are going to type of approach. One is generating evidence from basis from in vitro, in silico towards the drug development and examining. That is a routine conventional pharmacological approaches also we are taking. But second one is reverse innovation, reverse pharmacology approaches also. Both we are adopting. In these cases, actually, both approaches are very essential for us actually to generate an evidence. When we have some good evidence, particularly these things, particularly this single drug approach like oil, we are giving a single drug, and we are examining one or two medicines to improve the quality of life for patient compliance is okay, sir. It is also required, but now we realize actually we require a comprehensive Ayurveda approach, comprehensive Ayurveda approach. It is very essential. I think most of you are doing. I think panelists and other experts who came, they are doing whole approach, Ayurveda approach, not a single drug approach. They are doing panchakarma. They are giving some dhara treatment. They are giving some other shamana therapies. Whole approach we are doing. That is also very important. But this is very essential. We get some questions also. Somebody, I think some of you also actually told that the complications, if you are giving complications are less, and that means that chemotherapy bioavailability may be reduced, it may not be working, that's why you are not getting other complications. This was some comments also we are getting. That's why we will have all the we'll take almost all possible confounding factors while generating evidence also. We need to learn from various studies we had previously, and also finally what we understood that we need to have particularly three more modalities of the treatment. We have some examples. One is the prevention. For example, the predictive things. We are also getting some Prakriti-based studies to identify predictive markers and proneness, particularly in the cancer patients. And Prakriti, we are assessing. We developed a standardized portal of Prakriti, and we are doing multi-omic studies to with some indicators we are coming out, and with genomics and multi-omic studies, we will have Prakriti's based markers we will take in future. That is one approach we will take and we'll try. And second one is some conditions like submucous fibrosis, which are actually some we are also taking some studies, particularly those things actually how we can prevent them, we manage them, prevent them to actually and those conditions which actually which may lead to the cancer. In those important conditions we will take and we will study the for prevention, how we can able to prevent. That is also very good. That also comes as a preventive management is very very important. That also we will take, sir. With our your help, we will develop a strategy. We'll develop a strategy. What is the where which areas we need to the preventive, where Ayurveda has strength, particularly having the prevention of cancer at least at some that is one. Second one is improve standalone management. That is also an important issue where we can really do the standalone Ayurveda management. We have some examples. Actual chemotherapy resistance cases. At least nobody will object. Actually, when the treatment in clinics is different from doing the research, sir. If we are particularly integrative management is an excellent thing, sir. We are generating evidence to case report, case series, and pragmatic studies. And if you take a research studies, particularly, there is some ethical issues also will come. In that case, we require evidence. Standalone Ayurveda treatment, Ayush therapies can be given in chemo resistance and where unmet needs, where conventional management has no, particularly no management approaches or strategies. We'll take directly some examples in Pune also. Just we have chemo resistance and cancers particularly, or we can take the studies, which is a really an opportunity for us. Chemo resistance and other unmet needs we'll take as a standalone Ayurveda. Third one option we have always with us. Actually, we have enough good evidence that sleep, gastrointestinal symptoms, pain management, particularly in cancer, without interfering the pharmacological chemo and other therapies. We will do with our own treatments, excellent approaches. We will have very good evidences. Also, we generated for pain, gastrointestinal symptoms, cognitive dysfunction, particularly in cancer, and sleep disturbances and insomnia. These are all the anxiety management and all. These are some areas where we will have an excellent inclusive integrative protocols. We have a excellent scope. We have these are few areas. Both approaches are required. The level of evidences. We will work on simultaneously on the both way pyramid and reverse pyramid. Both we work. If you see the level of evidence pyramid, and we will reverse it also. We can do both approaches are very very essential for all of us to have an excellent decisions. As per CCRS is concerned, before concluding this, I want to put two important things, all of you, before that CCRS has an MOU with the National Institute of Health, USA, and oncology group. And we have been working with them, and we are trying to, we have developed an excellent systematic documentation protocol CCRS has developed, because we are sitting really on the gold mine, particularly not cancer, for other things. Particularly cancer, we have several people who are working simultaneously in silos, in clinicians, really they are working generated in evidence. But there is no documentation of these practices. CCRS has developed a format which is also published and validated, systematic documentation of reported medical practices for cancer in Ayurveda and Ayush systems, which is published. You can get from website also. Later, we developed after having discussion with ICMR and other groups, we developed a portal also, Ayurveda Interventions for Cancer. It is a portal. The portal, I request, I think those who are interested, I think they can contact our Manohar and Mumbai Institute, Dr. Reddy, and we can give the passwords, and we can give the access to that. You can report your give your data to the Ayurveda Intervention for Cancer portal. We will put confidential, because we have taken all care after taking ethics committee and other things and concern. That the data, particularly, we have done a big project, I think, across the country. I think Manohar must have consulted most of you and many people across the country who are really practicing Ayurveda for cancer management. And we documented various experiences as a standalone, as an add-on, different histopathological diagnosis of carcinoma, different stages, and different levels of treatment from Sodhana to Shavana, and different geographical regions, Maharashtra, Karnataka, and as well as Kerala and other places also documented, northern India also. And these things, the reported medical practices, we analyze, and we have a basic evidence that this set of formulation, this set of approaches, we can say, not Ayurveda is a system, it is an approach. Dr. Pankaj was also telling, and excellently, that he has given Snehanas, various approaches we are adopting, not simply we are taking only a single drug or single capsule approach. And these things, this we will document. We will have a basic evidence. The expert group consultation report will publish a report also. The expert group consultation report itself is a level of evidence. Actually, it gives it may not be this one gold standard of RCT, but it is a level of evidence. That also we will have something. So at least we have a working experience, we have a clinical outcomes, and pragmatic observations we have. That is a good level of evidence. That is very useful. That will all of your experiences will matter in generating this type. When it comes to the published by CCRS being an apex body, it can be positioned as one of the surveys, one of the good evidence. However, the case reports are already there. We have been publishing the experiences and things we have. This is a thing, and this I request all the participants who are there, all the experts who are here, their experiences can be shared. This is an excellent opportunity for us. Simultaneously, we are also there. Whichever, actually, the approach is two-way. Whichever is very well established clinical experiences, we go reverse how it is working. We go reverse. This is a basic evidence. We build upon these experiences. We will do the phase 2 directly phase 3 studies. Particularly now we have very good regulatory feasibility. We have ethically also. Wherever Ayurveda, where we are treating, there is addendum to the national ethical guidelines for biomedical research. We can go directly phase 2. Previously also we are going phase 2 studies where we have a good evidence and all, and we can go the directly phase 2 and examine wherever we require the basic drug interactions toxicity. We are but as a CCRS we are taking care of all those things, and we will also support with a good collaborative studies from whoever is having a good tangible and experiential evidence, at least tangible experiential evidence, which is which we can of that level, which we can take directly into the clinical studies. It is also required. We need not wait for longer studies. However, we are also trying to most of the Ayurveda drugs. We identify few drugs, Dr. Manohar, I request from these reports and experiences of the various experts, like here panelist, we have an excellent resource person since morning. We from these reports we will do a brainstorming session, madam. If you agree, all of you are Dr. And we will list out those important classical medicines which are used in management of cancer as a quality of life improvement, as a management. We'll invest. We are doing drug interaction with 100 classical Ayurveda medicine with almost all possible allopathy drugs we are doing. We will do this study also. The drugs which are generally the Ayurveda drugs and approaches which are used in whether in a procedure-based like therapies like panchakarma and other things, whether a single to manage the quality of life or to manage pain, and that whatever we list out, we'll try to have a drug interaction studies with most common chemotherapeutic agents will develop, at least it will ease us for having a good integrative approach in future. Anyhow, we are doing for other drugs, but we'll focus on cancer. We'll identify these drugs which are commonly used, which are common chemotherapeutic agents. It will be evolving, but we'll do this. We'll take a project, Dr. Manohar, and with some good, we are doing the drug interaction studies. We have good models of six study models. We have a basic evidence of CYP450 method that we can do. We can also do bioavailability PK studies in animals giving chemotherapy and our therapies, how it is interfering the bioavailability. This also gives not only treating the integrative care as an adjuvant or add-on, we can also give dosing pattern. After chemotherapeutic agents we are giving, after how much time we will give Ayurveda internal oral medication. This is also we will have with PK studies we are doing. Why I am telling, we have an example of anti-tuberculous, MDR TB, anti-tuberculous drugs we are giving Ayurveda, we are getting good results. We identified after rifampicin, after how much time we can give our drug. That also we have identified that time and drug dosing types. These things, various things which will facilitate us actually to convince the conventional oncologists, so that these evidences will help us freely getting cross referrals from them. We can also refer them, they will also refer us. This cross referral approach is very, very important. In drug interaction is very good proposition to improve the cross referrals besides the clinical efficacy evidence. And I think I compliment all the experts, the expert panelists, all the three. I think I was keenly listening to them, and all the four experts who has given the presentation, and all the participants who are here. I was keenly observing and learning many things from you. And I congratulate all of you and thank you being with CCRS for this initiative taken by our Carrie Mumbai. And I again thanks Dr. Manohar and Reddy for actually making this possible and realizing this task and gathering this many experts and bringing to one platform. Thank you very much. We also will be having good brainstormings in future in this some areas what we today identified. Thank you, Dr. Manohar. Thanks. Thanks.
Thank you, sir. Thank you very much for this inspiring address and concluding remark. Thank you very much for your support for, in fact, the entire structure of the project program and was chalked under your guidance and the entire support for conducting all these webinars and today's web conference. Thank you very much. As you said, I think this group will the work as a whole for various challenges, as we mentioned about the interaction and other things also. Definitely, sir, we'll plan some other activities and we'll be in touch as a group, as a whole, this entire integrative oncology experts. And in coming years, I think this can be what I mean that in coming years, integrative oncology along with Ayurveda will have better golden days. I hope that. So with this, we are coming to the last session, that is vote of thanks. My senior officer, Dr. Vipin Sharma, is here. I request Dr. Vipin Sharma to please express the vote of thanks.
Dr. Manohar, one small point I want to add before we finish. You kindly bring with the proceedings of 6 pages with
Yes.
recommendations of this
Yes.
panel or an expert group. We'll take the good studies, 1 or 2 studies immediately.
Yes, sir.
Thank you, sir.
Thank you, sir. Thank you very much.
Thank you, Dr. Manohar. It's my honor to deliver the vote of thanks on behalf of RRAP CRI Mumbai. As we conclude this wonderful event, I would like to express my heartfelt gratitude to our distinguished speakers and panelists who contributed to the success of this conference. Professor Dr. Vinita Deshmukh, Dr. Avinash Kadam, Dr. Vittal Uddar, Dr. K. Madhu, Dr. Zankhana Butt, Dr. Pankaj, Dr. Sharad. Your insights have significantly enriched our understanding in the subject, and presentation discussion were enlightening and thought-provoking. Thank you for sparing your valuable time for this conference. Definitely, your experience in the field will benefit to the last person available at health ecosystem. I would also like to acknowledge the hard work of Dr. Manohar Mundeti, Research Officer CRI, and his team, including Ms. Namrata SRF, for arranging everything to make such conference successful, and series of web events, including creating Google Forms and keeping database updated for conference. Your dedication and meticulous planning ensured that everything runs smoothly. Thank you, Dr. I also extend my thanks to Dr. Govind Reddy, in charge RRFP CRI, for your technical administrative support in organizing these events in last many days. One thanks is also due to Dr. Subhash Sharma, Research Officer, CCRS Delhi, and IT cell of the CCRS headquarters for providing smooth technical support like creating web links and streaming live on various internet platforms. I would also extend my special thanks to Dr. N. Shrikant, Deputy Director General CCRS, and Honorable Professor Ravi Narayan Acharji, Director General CCRS, for pushing us by providing continuous encouragement and guidance for making such events fruitful. Lastly, I want to thank all the attendees for your active participation. Your enthusiasm and engagement have made this event a memorable one. I hope you found it as informative and applicative in our Ayurveda practice. In conclusion, thank you all once again for being a part of this occasion. Your presence and contribution have made a significant impact, and we look forward to see you at our future events. Thank you. Have a great evening. Thank you very much.
Thank you, sir. We'll close down here, but we look forward to be in touch in coming events in coming days. See you then. Thank you. Namaste. Thank you, Vipin sir. Thank you.